conduct ourselves. We need to have the information from the CDC and from our partners that Glenn works with every day. So I just wanted to add that because I don't think we can make any kind of a decision until we get the information. Thank you.
Thank you. Commissioner Udine and then Commissioner Furr.
I just want to follow up on a couple things because I agree with what the county attorney's office is saying, that it may be better practice to do it one way or another, but it's perfectly acceptable to have a public meeting and make a resolution at that meeting and it can be voted on. But I'm going to get to that in a second. This, every year when we go through hurricane season, we're all glued to our TVs when there's a hurricane, and we all see the two people usually, the day the hurricane's humming, that go out on the surfboards in the middle of the ocean, and we say to them, you know, you really shouldn't be doing that, and we all watch that on TV. This is a cruise ship that started their cruise. This ship started their cruise well after the coronavirus thing became public, well after there were incidents of the port as far as having some issues there. These are people that went on a cruise, embarked in South America in mid-March, and there's 1,500 people on a cruise ship with 49 of them showing symptoms. I think that we're perfectly well within our rights under the tariff to refuse them disembarking in Broward County. We have the whole county, you know, quasi shut down right now. The governor is telling flights that are coming in from the United States that they have to self-quarantine. There's no way to figure out any of that stuff out. This is something that we have right before us that's happening right here. I'm going to reiterate my motion because I think we should vote on this now. I put in my motion, if the CDC is able to test those people and say that it's safe, then let them off. But until they do that, and I'm not relying on news and I'm not relying on information from Holland American Cruise Line, if the CDC and the Florida Department of Health can determine that it's safe to let them off, then it's okay to let them off. But until we get those assurances, my motion is we waive the rules right now for public comment. We don't need public comment on a resolution. The public is not going to come in here and comment against this. And we put forth a motion that until we get those insurances from the CDC, we vote not to let that cruise ship disembark at Port Everglades. It's a danger and it's an emergency to our residents of Broward County. And I think we can do it now. It's easy to be doing it now. If in the week they can get this done, so be it. I also think, and I agree with what Commissioner Furr mentioned as far as humanitarian reasons and what we're going to do here, but we have people in nursing homes that are Broward County residents and elderly people that can't get the equipment that are here, that haven't gone on a cruise, that didn't get on a ship March 10th after this was all blowing up. They did nothing wrong. They can't get the equipment. We're going to take now out of stretch resources and bring that to deal with an international ship with international passengers that did not embark in Port. These aren't people that went out of Port Everglades and are coming back. There is no reason for us to do this unless we have 100% certainty. So I'm going to reiterate my motion. If we don't vote on it, we don't vote on it. We can come back another day. I really don't care how we do it, but my motion is we waive the rules right now of this meeting. We vote on a resolution to instruct the county administrator and the port director not to allow this ship to embark in Port Everglades unless we get full clearance from the CDC and the Florida Department of Health that it's safe for our residents to do so. That's my motion, and we'll go from there.
Commissioner Furr.
Thank you. I'm actually I'm on a different topic for a minute. I appreciate what Commissioner Ryan was bringing up with regard to trying to help keep people employed. The idea of some of the projects that are going on at the port. One of them had to do with rebuilding the seawalls, right? There's another project going there, smaller project. That was your. Yeah, but there was also a seawall.
Well, there's another project that we have in the pipeline.
Right. And you were doing
for
right.
reconstructing existing bulkheads.
Exactly, yes. The bulkheads, right? And you were going to do one at a time, and you were going to phase it all the way around, right? Is there a way of accelerating that?
Well,
because that, and I know you got to keep them open, and you're keeping like one open, and all the other ones are being used. But is there, while you don't have the same kind of traffic that you normally would have, does it make sense to try to accelerate some of those so you can one, keep people employed and get all the work done. Yes, no?
Well-
If I might
Yeah.
add to this.
County Administrator.
If I can take you, many of you back to 2008, 2009, and I'm sure Commissioner Ryan, you would remember, and during that really deep recession, one of the ways that if you go back and you look at
Budget
what was
ready.
going
Yeah.
around the state at that time and what was going on in Broward County, it was our capital projects, the runway project. There were a number of
Right.
capital projects that we pushed. We moved them up and we pushed them out to get these, our own stimulus, if you will, going. It was very successful. We would do that. We're going to have to balance it out, as you heard the conversation with cash. And that's something that I've got a whole team of people now looking at overall how are we going to manage our finances. And we're not I'm not suggesting that we're doing it piecemeal. We are looking at it very comprehensively, but one of the main reasons for keeping these projects up and going is to keep our economy going. We have a partner in many instances in these projects countywide, and that's our municipalities. And that really relates to whether or not their building departments are open and they have the resources dedicated to kind of keep these projects on par. We have indicated to those that are working with us on our projects, we really want you to be sensitive to the extent that you can about the social distancing. Some of our municipalities have worked with us. They've worked out an arrangement with the contractors so that they know how they want to move forward with that. And so as long as everybody's cooperating, I think we won't have an issue. If there becomes a problem, then we may. But that's something that we clearly would agree that we have projects ready to go. We have cash to support those projects. There's no reason to hold them back.
Right.
Unless we
And I
have
do
some
remember
other
that
issues.
from looking at it from watching what the county did back then.
Yeah.
And I was very proud of what the county did back then, even though I wasn't county commissioner at the time, but I thought it was amazing what did take place.
Yeah.
And keeping a number of people employed was amazing. And we are in the same, we're
Yes,
in
we
a very
are.
similar situation.
Yes, we
Which is
are.
why I'm asking if there are those kind of projects where I know we're, like the ramparts, if they're, not the ramparts, bulkheads.
Bulkheads.
If there's ways of ramparts, accelerating those things, maybe we should start to look at that. I know, I went straight to the Star Spangled Banner.
Well, yes, Commissioner, and you're right. We actually have an RFP that's about ready to come to the board
Okay.
to start the design process.
Okay,
So
yeah, those kind of things.
it's in the pipeline.
Good,
but
and
Still,
if we
still a
can,
ways away from being able to actually
Okay.
execute from a construction
and I know this is
standpoint.
off topic a little bit, but same with the surtax projects. Those have all been prioritized. We may want to take one more look around and see which ones employ people here, as opposed to, and most of them do. Most of the municipal projects are earmarked for that. But we may want to take a second look and make sure that they are, that they could put people to work as much as possible.
Yes, our team has been chomping at the bit to get my attention redirected
Yes.
to surtax,
Yes.
and that's going to be relatively easy to do.
Right.
Because, again, that's a way to keep money flowing into the community and keep people working where we can make sure. And, you know, a lot of these projects, they are going to have A&E work done. So we can keep that pipeline going where we also protect everybody to make sure that they are adhering to the overall, you know, work from your office, don't mingle, the whole 9 yards.
Right. And then finally, I think it's going to be really important that we maintain our humanity during this entire crisis. That we continue to look out for each other. And if there's a ship at sea or somebody struggling wherever they are, we should be looking out for them. And that's going to be something we're going to be facing way more than we want to. And rather than having people, struggling on their own wherever, it's going to be wherever we can, we got to be looking out for people. And this is going to be one of those instances. And I want to be on the right side of that.
I think that based on the information we have, we're not ready to make a decision at this point in time. One, we don't have any CDC confirmation as to what is really going on that ship. Two, the people that we've hired, competent people in our legal department, are suggesting that we are able to come back in time to stop this ship from coming in if it's necessary to do so. And I believe that when we have legal counsel, we ought to adhere to them. And I respect our legal counsel enough to listen to them. They are suggesting that if we need to, we can come back and take the action that we are here talking about taking, and that because we don't have public input available, which is based on our sunshine laws, that we ought to have the public weigh in and hear their voices. And yes, maybe every single person may support it. Maybe one might not. But I think that we ought to follow the guidelines that has been stated by our county legal team as we go forward on this issue. So on the advice of our council, we'll move to the next item.
Mayor, I would like to get in the queue.
Okay, go ahead.
My only comment was when I brought this up, I was the one that brought it up. All I said was we should have a policy. That's it. I wasn't, and I think we need a policy. And I agree with Commissioner Burr in being humane. But remember, Miami's closer than Fort Lauderdale. It's 6 days out. There's plenty of ports to go to. So if there's really an urgent need, this ship should be able to dock way before 6 days. But all I'm asking is, when I first started, was commissioners to come together and have a policy. So if we have a policy in place, so if there are people who are sick, we have a duty to the people that elected us first, I believe.
And as explained by our county attorney and the county administrator and the port director, in our agreement with these ships, we have the right to stop them from docking.
Right, but
So
Mayor,
we have
what
a
I'm
policy
trying to say
already
is,
in place.
of course we have the right to, but the board has not put forth together a policy, and that's all I was trying to say. Is we should put together a policy, whether that policy is to let them in or the policy is not to let them in. I think, and the second thing I wanted to ask our county attorney is, since Commissioner Udine made a motion and there was a second, doesn't the Robert rules require a vote? That's it. I'm done.
I mean, not if it violates our rules.
Yeah. Okay. I'm just trying to see if we put a policy. That's all. Whatever that policy is, I just think it's smart that we have a policy and not just hope that that something happens as we have policies for everything. So,
yeah. Commissioner Bogan,
I'm done.
I'm not sure you could hear that Drew responded to your question indicating that no, given that this is a workshop and it's been noticed that there would be no official action taken, there's nothing required at this point.
Okay.
And
I'm sorry.
Commissioner Bogan, I think our staff has noted your comments on this policy. They're not in their head here.
we don't-
You haven't seen it. Okay.
Well, we don't have a policy, but okay. Thank you, Mayor.
Thank you. We'll have now our Convention and Visitors Bureau CEO, Ms. Stacy Ritter, make her presentations. Thank you very much, Mr. Wilshire, for your work.
Well, good afternoon. This is a difficult one since for the past 4 years I've just come to you with Lots of good news over and over and over again. So I'll start with some better news. First of all, our new ad agency starts on April 1st, Aqua. But our marketing team has been in daily contact with Aqua over the past 2 weeks since you approved their contract, and they have volunteered to help us during this crisis. So they are right now working for us for free, which we are very happy about. This week, they're meeting with our current advertising and agency, Starmark, to organize a seamless transition and a transfer of assets. Currently, we've stopped some of our advertising initiatives, including paid ads, print, and consumer emails. We do not want to sound tone deaf during this particular challenging time. We're saving our resources for future campaigns, and I'll remind you that it was just 2 weeks ago today that you authorized an additional $500,000 to our new advertising agency for adverse impacts. I have a very strong suspicion that we will be blowing through that relatively quickly. We're working on a strategic marketing campaign with WACA right now. Based on our research, and we're doing lots of research with our industry partners from STR, which is Smith Travel Research, Skift, U.S. Travel, Destinations Florida, formerly known as FADMO. Based on our research, the key is to watch the curve and wait for it to drop. Once that happens, we will start focusing on the drive market with our new summer campaign, which we have titled Lauder Deals, which is how to save on hotels, restaurants, and things to do. On our website, sunny.org, we have a homepage which has alerts for COVID-19 updates, delivery and takeout options for our restaurants, and virtual experience links. Work is still being done on this page, but on that particular page. On sunny.org/health advisory, we have insight and information on COVID-19 for visitors and residents. On sunny.org/industry updates, we have COVID-19 information and materials for the travel industry, which include talking points, what the CVB is doing, and other related updates that come from the county. We also have a page, sunny.org/dining. We've created a landing page for restaurants offering delivery and/or takeout. There is a sign-up form for every restaurant through every particular venue we have, most particularly social. We also have a page for virtual vacations, sunny.org/virtual vacations. We have a sign up for that as well. Currently, we're featuring the Bonnet House, Butterfly World, Stranahan House, the Museum of Discovery and Science on the South Florida Symphony, and we continue to gather assets on a daily basis from our industry partners. There's, as I said, an attraction sign up form. We're also starting, just this morning, we had a conference call. We're going to be starting a campaign recognizing our local heroes, which we will also put on a page on sunny.org. We're working with our new agency, Aqua, to pinpoint local heroes, whether they're nurses, doctors, people who work at grocery stores, whatever, to reach out to the community. We believe that our primary stakeholder is our resident, and we want to show them that the CVB is relevant both when times are good and when times are not so good. With respect to social media at Visit Lauderdale, we've launched at Visit Lauderdale Eat Local social media campaign. We have more than 100 posts promoting restaurants for takeout, delivery, or similar service on Instagram and Facebook stories. We received over 42,000 views in the first 24 hours on Instagram alone and have over 70,000 views to date. The campaign was reposted by several local media influencers, many of the highlighted restaurants, and local organizations such as the Hollywood CRA, increasing exposure for our restaurants during this critical time. All at Visit Lauderdale social media channels, including Twitter, Facebook, Instagram, and LinkedIn, are also being used to communicate destination news related to COVID-19, support local initiatives like Hands for Hospitality, and encourage partners to sign up for sunny.org listings to promote their businesses during social distancing. As I said, our next campaign is focusing not only on local heroes, but we're going to push out a virtual vacation offering. Now for the not so good news. January 2020 was 15% higher in TDT revenue than January of 2019. In January and February, we had 18 days of occupancy greater than 90%. March 1st to 7th showed some small declines. March 8 to 14, 2020, occupancy decreased 23%, RevPAR decreased 29%, and we are expecting double-digit declines to continue for the next 2 weeks. We won't be receiving numbers until tomorrow for March 15 to March 21, but we're hearing from our industry partners in the hotel sector that they're experiencing 10 to 14% occupancy. Not a decline, 10 to 14% occupancy. We have sent surveys to all our hoteliers to update their status. The group sales team is now calling every hotel in Broward County, much like we do during a hurricane, to determine what their status is. We're not getting a great hit on the survey responses, so we're reaching out to them one-on-one via the telephone. As of today, or actually as of yesterday at 5 p.m., we've got approximately 39 hotels have suspended operations. 6 are larger properties, and one is a hotel group of 12 smaller properties, North Bay Village, that accounts for approximately 3,600 rooms. These include the Seminole Hard Rock, the Diplomat Beach Resort, Margaritaville Hollywood Beach Resort, Le Méridien Dania Beach, Inverary Vacation Resort, Beachcomber Resort, and the North Beach Village Resorts I mentioned earlier, which is that collection of 12 boutique hotels. Of that remaining, there are 21 smaller lodging properties with room counts that vary from 5 to 30 rooms, which are currently closed, represents another 200 rooms. Operational hotels, and I use that in quotes, are skeleton staff with majority of their staffs furloughed until further notice. The Marriott Harbor Beach last Friday furloughed 80% of their staff at the hotel. Few closings and a half a dozen properties have indicated that they are discussing suspending hotel operations, such as Bonaventure, the Pelican Grand, and the Ritz-Carlton Fort Lauderdale. We expect that number of those who are considering suspending to increase in the next 48 to 72 hours. Coldwell Banker Richard Ellis, known as CBRE, the largest commercial real estate services company in the world, is forecasting demand for overnight hotel stays to take 6 to 10 months to recover, with ADR and RevPAR taking a 12 to 16-month recovery. Some are saying it will take 18 to 24 months for international travel to rebound to the levels we've seen in previous years. It's important to note that international travel was already on the decline before it came to a halt for a myriad of reasons, including geopolitics, strong dollar. People get a little nervous traveling during an election year, regardless of who's up for re-election. So it was declining, but clearly not this significantly. And experts agree that we have not yet hit rock bottom in the tourism industry. Most agree that whatever time it takes us to get there, it will take twice as long for us to recover. Tourism economics, which is another data point we use, is saying this will be more than 6 times the impact of 9/11. Oxford Economics is saying there will be a $3.6 million U.S. direct travel industry. I'm sorry, sir.
Million? Okay, go ahead.
3.6 million jobs will be lost, direct travel industry jobs, with a total impact of 4.6 million jobs. We've had 49,863 group room nights cancel for the months March through May. 51% of what we had on the books has canceled. For March, 60% of the committed rooms have been canceled, 17,000 rooms. For April, 67% of our committed rooms are canceled, that's 27,000 rooms. And for May, 19% of our committed rooms have canceled, that's in excess of 5,000 rooms. To date, we have had an $8.5 million loss in room revenue with an economic impact of $61.7 million. The U.S. picture is not pretty, and it's only going to get worse. All signs point to the fact that, as I said, we have not yet hit rock bottom. We are approximately 6 weeks behind China. That was what we thought. Smith Travel Research now says that we're about 8 weeks behind China because occupancy isn't falling at the rate it did in China, and because we won't hit rock bottom as quickly as we did in China, and that will mean the U.S. will have a much longer recovery time. We are simply prolonging our pain. Large hotels with meeting space have been hit the hardest. We'll continue to see a double-digit decline in RevPAR. The silver lining is that travel always rebounds, but again, we are just prolonging our pain if we don't do what's necessary to stop the bleed. And Smith Travel is now tracking hotel closures, but they have not yet published what hotels across the country have been closed. On a side note, Tampa and St. Pete, Clearwater were called out and shamed for having the highest occupancy among the 25 beach markets the week of March 6th because they didn't send spring breakers home and close the beach. Brand USA is saying that, and this is a report that they published on 3/19, travel sector revenue will average 75% below normal in March and April. As I said, 3.6 million jobs will be directly impacted, with 4.6 million total. In travel, however, there's a cycle. It's called a booking funnel. People look out in the future for when they're going to book. So most of us believe that there's a consumer cycle of emotions that we're seeing, and once everyone gets past the shock and frustration, there'll be something called consumption dreams. And travelers will begin to explore where they can go when they're allowed to go. And finding that point is key for marketing programs and enticing campaigns, which is one of the reasons we're posting virtual vacations. People are going to look at where they want to go 6 months from now. As China starts to recover, the travel sector is researching and surveying Chinese travelers about their future sentiment towards travel. And it's showing some positivity. The Chinese are starting to travel again as they come out of it. It's not going to be pretty, but as I said, tourism does always rebound. We're going to be ready for the consumption dreams as travelers move past the shock and frustration stage. And when they start to dream and explore they want to travel, we will be ready for them electronically. We'll be focusing on the drive market as restrictions are lifted because we believe that that's where the low-hanging fruit is. On March 19th, Arne Sorensen, who is the CEO of Marriott Corporation, held a webinar, and here are a couple of the key points that were takeaways from that webinar. This is the most severe hit to a hotel chain since the Great Depression and World War II. Global business is running 75% lower than normal. Hundreds of hotels have closed, many will never reopen. There's a 25% decline on average in hotel revenue globally, the worst quarter ever in Marriott's history. They are furloughing tens of thousands of employees for 60 to 90 days at least. They've suspended all non-essential travel. There's a hiring freeze with the exception of a small number of mission-critical positions. They've stopped all initiatives and suspended brand marketing and advertising. And they saw a 90% decline in business in China at the height of the pandemic. It's not a pretty picture, and we're all going to go through a great deal of pain as we move through this. But that's what the CVB is doing, and that's what the picture is globally.
Thank you.
Questions for the
We'll start with Commissioner Sharif.
Thank you, Ms. Ritter. I think that with all of what's going on, I've been hearing lots about the hotel industry and the declining revenue, and them trying to reach out and get loans to assist them. Many of them can't qualify for the DEO loan. So have you been hearing anything about them getting the SBA loans or reaching out to the SBA? Because I had someone call me and they said they were $100,000 in already and they were laying off employees.
What we're doing on our travel industry page is we're indicating what we have started to collect the information on where these hotels can go to for loans, grants, etc. Obviously, as a CVB, we don't do loans and we don't do grants, but we are providing the information to the industry on where they can go. Many of the, when we think about hotels here in Broward County, we think about the big ones mostly, but there are lots of little mom and pops out there that are 12, 15, 20 rooms, and they don't have the staff to do the research that's necessary for them to figure out where they can go for that kind of information. That's where we think the CVB can be a best resource to these people at this particular time.
Yes, and so do I. That's why I mentioned it, because I would imagine that it would be the mom and pop hoteliers that are having problems, and just wanted to make sure that they were aware of what's out there. The only thing that I know of is the DEO loan, and that's for up to 100 employees, and I'm not sure everybody qualifies for that either. So, and that's only $50,000. So I'm just wondering, you know, as far as the tourism industry and the hotel industry, that we're making sure that we're doing everything we can to help them to sustain to this period.
Well, we're doing everything that we can to make sure they have the information that they need. And if they've got any questions, we have an email address for questions, GFL Marketing at Broward.org, that is specifically for questions related to COVID-19 and any issues that arise. But again, we don't lend, we don't give grants, but we are here as a resource for information, and we've taken everything that we've gotten from county administration and from the PIO here in Broward County to push out, because in addition to other types of information like the ones you're talking about, Commissioner, because these people just don't have the time or the resources to do it themselves. And as I said, because we think that our primary stakeholder is the resident, it's what we should be doing.
Right.
Okay.
Thank you. Thank you for the work that you're doing.
Thank you.
Commissioner Ryan.
I can understand how everybody's getting stir crazy, just hanging out in their house and not being able to enjoy the parks, enjoy the libraries, enjoy the amenities. So as soon as they can get out of town, as soon as it's safe to come into town and enjoy everything that we have in South Florida, I agree with you, things will start picking up. We have a much lower occupancy rate now as a result of the virus, but what have you seen as far as how the hotelers have adjusted to this drop in demand? Are they dropping their room rates, and is that having any effect on bringing any additional persons that are renting hotel rooms?
The truth is, Commissioner Ryan, people aren't traveling right now. They're not even thinking about the cost of a hotel room, and the hotels aren't advertising and marketing to bring people here at this particular point in time, all recognizing the sensitivity of asking people to come to get away, many of whom can't right now, are not allowed to leave and wouldn't anyway. So, and with the executive order that was just passed, there's even more restrictions on who can come into a hotel. So the answer is no. I mean, we have anecdotal information. I've got a woman who works at the CVB. Her husband's an American Airlines pilot. He did a transcontinental flight from LA to New York. Earlier this week, there were 18 people in coach and 4 people in business class and nobody in first class. So nobody's traveling right now, and it's clear from the numbers, both from what Mr. Gale told you and from what I'm telling you, that it's just not the time to reach out and say, yeah, come here. What we're doing is soft pedaling. We are still a beautiful place. We are still paradise. Our beaches are still pristine and our waters are blue. So when you're ready to come here, we anxiously await your return because we are ready to welcome you.
As soon as the beach is open. So we're going right out of the tourist season, and let's just say this, the virus kind of breaks in 2 months, 3 months. What does this mean for our summer season? Because you have a different crowd, and I think it's more like the crowd that you mentioned, the drive crowd. What do you foresee happening in the summer? I mean, obviously, it's contingent upon, whether or not the virus, the spread of the virus slopes down. But assuming so, where are we going to go with the number of people, the percentage of people that will be renting hotel rooms in Broward?
We've already started working on our summer campaign. We have Starmark currently working on it, and that, of course, will transition next week when Aqua comes on. So we have already started what we're calling water deals. 50% of Broward County's tourism is from the state of Florida, residents who live in the state of Florida. So we don't expect that will change. People are going to want to drive. So what we are focusing on, or will be focusing on, depending again on what opens up and when the airlines come back, when they put their routes back on, is the drive market in the southeast of the country, Atlanta, south, people who can drive here within a day, and how we can then work to get their business, recognizing that once this opens, everybody's going to be doing the same thing and just inundating people with come here, come here, come here. So the Lauder Deals program, which used to be called which was our just called a summer program in the past, has a variety of things, whether it's Restaurant Month, which will be 60 days, Restaurant Months, this time in August and September, where you can get a prefix 3 course for $38 to encourage people who live here and people who can drive here to come and take advantage of all of our culinary opportunities. We've got spa deals during Spa Month. The month of September, we'll probably increase that to the month of August as well to make sure people come to get a spa treatment for half off or a gift for free. The hotel rates are lower anyway in the summertime. And what's interesting is that some of the groups that, while the leisure market has really fallen off a cliff, some of the groups, not the ones that I mentioned here, which were canceled, but some of the groups have postponed till August, September, and October. So we expect that the last calendar quarter of 2020 will be really amazing here with our numbers. We've got Pride of the Americas, which rescheduled to the first week of November. Tortuga rescheduled to the first week of October. People will come back, and we're going to be ready for them. So, summer's always a little slower. This has given us an opportunity to catch our breath, especially during a transition from one ad agency to another, which none of us in the CVB has ever been through. But it's not going to be easy, and it's going to be painful. But we've got 50 people at the CVB who are all dedicated, who are sitting in their offices, doing their jobs right now.
We're going to take a break after this presentation is finished, or recording secretary, I'm sure, needs a break.
Yes, we need to give our captioner and recording person a break.
Okay, so we'll finish this, and then we'll take that break for 10 minutes. Commissioner Furr.
Thanks. Thank you, Stacy. I know this is a tough time, but no good words for it, but keep it up. Local numbers, you gave kind of bigger numbers in terms of numbers of people unemployed, et cetera. What's the local number? Do we have one?
I can tell you that about 93,000 people in Broward County are employed directly by the tourism industry. That number doubles if you include indirect, which are retail, restaurants,
right,
non-traditional hotel. But I can only give you anecdotal right now.
Somewhere, okay, but that gives me a...
The hotels who are closing, those people are gone. The
Right.
hotels that are suspending operations, 80% of their people, and unfortunately, to the people who can, I've been sitting here all morning listening to you, especially
Right.
Commissioner Furr. It's people who can least afford it. It's the valets and the housekeepers and the bellmen,
Right.
who can least afford to lose their jobs. And I will tell you that U.S. Travel Association, which is the advocacy arm, is in Washington, D.C., lobbying on behalf of the industry for any one of the bills that may pass in Congress
Right.
this morning. We don't get involved in them because until you take a position as a board, we step back. But we have people who are advocating on the industry's behalf in Washington, D.C. We have people who are advocating in Florida. Destinations Florida advocates for those people, and hopefully we'll see some relief for them.
Yeah, hope so, because I think almost all the bills have some, and I think they recognize in this industry is probably the hardest hit.
Yep, I would venture to say that that's
Yeah.
true. Look at the restaurants. Every
Right.
restaurant is shuttered.
Yeah, and these are the ones who have no safety net, almost none.
I spoke to Tim Petrillo on Friday morning. He owns 11 restaurants in Broward County. The restaurant
Yeah.
people, he laid off 500 people last week.
Yeah, these are people that don't have health insurance. They don't have. There's no backup for these
No
people.
severance.
None.
Nope.
And so that, just like I've mentioned with the airport and seaport, we need to help those people navigate. And maybe we can push stuff out to you, and you can push it out to them.
Absolutely.
How to apply for food here, this and that, just so that they can get some relief on it. Thank you.
Vice Mayor Gala.
Thank you, Mr. Mayor. I have no questions for Ms. Ritter. She has left me too depressed to speak.
Commissioner Fisher.
That's hard to do, Commissioner, Vice
Thank
Mayor.
Yeah, thank you, Mayor. Ms. Ritter, thank you for those devastating numbers. They're just devastating. But want to obviously commend you for pivoting your marketing campaign, which you talked about at the very beginning. I just want to commend you for that and making that change and making that pivot to where you need to be. So thank you.
Thank you.
Commissioner Udine.
Thank you.
Thank you, President Ritter. I think that, I mean, your numbers are mind-boggling how quickly and how steep this fell off a cliff. But I think that the local market, and even, I know you're talking about the one-day drives from Atlanta, and I agree with that, but even the hyper-local market is going to really be the area that I hope can bring us back quickly, because you're going to have people cooped up in their houses all throughout the area, so hopefully they're going to be able to, start using these facilities the same way they're using takeout now to try and support those businesses. I hope you include that, and I know you will in your marketing to support these are our neighbors and our friends that own these businesses and that work in these businesses, and this is how we would keep them in. I just also encourage you, kind of like what we said with the airport and the seaport, as far as liaisons for the workers, if you could direct them in the right places, they may do that. And also for the small hoteliers, I know that most of them operate with bank loans, and I know most of the banks are receiving notice from their regulators that are telling them to work with these small businesses, because it won't be dinged against you as a bank if you waive, if you delay, if you go interest only, whatever it could be. So there is that out there. I have nothing to add, but I just appreciate everything that you're doing, and I look forward to seeing you back here when you ask for more money for emergency advertising to bring this market back.
Mr. Foster, did you hear that? Ms. Henry? Thank you. Our summer programs have been very much geared to the resident, recognizing that they have to market and promote outside of the county to make sure that we comply with the state statute. But if our residents take advantage of our deals, so much the better, right?
Commissioner Bogan.
Yes, I thank you, Stacy, for everything you're doing. I have no questions.
Commissioner Rich.
Yeah, thank you, Mr. Mayor. I guess it's good afternoon, Stacy. I want to thank you for making the point consistently that people are not traveling now, and I think it's very appropriate for us to be conducting ourselves the way you are, with not advertising, going out and talking to people about traveling, because all morning long I too have been talking about people who live paycheck to paycheck and can't go anywhere and don't have jobs, any of them anymore. So I think we need to be extremely sensitive to that, and I think that you have been. I was on the phone with Weston Commissioner Jaffe last night, and he is an American pilot, and he told me that his plane both ways, up and back, that he flew this past week, had 18 people on it each way. So and you know that American has canceled many of their, I think, something like 55,000 flights. So people are not, traveling. So I appreciate the sensitivity there. I do want to mention one thing. There are nonprofits in our community that are in need of housing during this period of time, in particular, possibly for COVID-19 virus quarantine, people who have, had to quarantine themselves. We have people living in residential care, like ARC Broward. I think there's about 66 residents there. No one, fortunately, yet has had to quarantine, but the possibility is obviously there. And I know that you responded to an email that Dennis Haas sent, and you mentioned one hotel. So in light of what you presented today, I wonder if you could put together some kind of a list. United Way has used a lot of the hotels, motels during hurricane time, and I can envision that we obviously have the potential to need that here. So I was just wondering if there was a way you could put together some kind of a list that could be utilized by the nonprofit community and others, but primarily for, really needs for local housing, whether it's, people are in transition, homeless, whether it's, developmentally disabled, whatever the particular community.
Yes.
I think that's a possibility.
Oh, absolutely. And I'm glad you mentioned Dennis, because I did want to say that we found him those 66 rooms in the event he needs them. We put him in contact with 2 different hotels that were willing to help him. We can add that to our survey question, and we'll add it to our calls, to our individual calls to each hotel, and then we'll put something on the Sunny.org website. We always send our stuff to Margaret Stapleton as well, so if she wants to push it out on the Broward.org website as well, we can absolutely do that.
Okay, great. Thank you very much.
Thank you, President Ritter. Yesterday, I was actually on a call with some of the hotel owners. They were on with a couple of members of Congress discussing the aid that they're looking for. This group was the minority groups, the Asian hotel owners and Asian American hotel owners and developers, and the National Association of Black Hotel Owners and Developers also. And they had a list of hoteliers in Broward and South Florida who were willing to work with us on just what Commissioner Rich mentioned in terms of assisting with housing, whether it be the National Guard or the people who might need to be put in quarantine. The other point I'd like to ask your support on is, as you get these hoteliers and send the information out, our Office of Economic Development Small Business is actually working to see how they can assist and put information out also. And this Small Business Development Center, they're focused on helping those small businesses to maneuver the bureaucratic system that exists to get a loan, because it's not always easy and understandable. So hopefully you can add them to your list of resources.
Sure. Thank you.
And finally, let me thank you for reiterating that our residents are our primary stakeholders. Without them, the hotels wouldn't run. So thank you for that, and supporting of Commissioner Furr's suggestion that we try to figure out how we can assist these folks who are very low income, who oftentimes actually take the bus to work because they have no other means of transportation.
I had a conversation, and thank you for that, Mayor. I had a conversation with someone in my office earlier, and we talked about, why can't you just shut down the whole county? And there are so many parts of this that people don't think about, like the person who works as a valet in a hotel who has to use transit to get to work. They don't have a car. I think as we all struggle through this, we are finding out so many pieces of this massive puzzle that is Broward County. And I hope that as we move through this, we will all remember it when times get better, that there are always people who are less fortunate, and we should always be there to help them. Sorry, that was my soapbox as a resident.
Well, with that, thank you for your work. And we'll take a 10-minute recess.
Now is the time for everyone in Broward County to be vigilant in helping to stop the spread of the COVID-19 virus. If you are sick, please stay home. Avoid close contact with anyone showing respiratory symptoms. Avoid directly touching public surfaces like handrails or gasoline pumps. Wash your hands frequently with soap and water for at least 20 seconds and use hand sanitizers that contain more than 60% alcohol. Cough and sneeze into a tissue or your elbow. Avoid touching your eyes, nose, and mouth. Avoid large crowds. Out in public, keep at least 6 feet between you and others. Finally, keep calm and try to maintain a healthy lifestyle. For more information, visit floridahealth.gov. time for everyone in Broward County to be vigilant in helping to stop the spread of the COVID-19 virus. If you are sick, please stay home. Avoid close contact with anyone showing respiratory symptoms. Avoid directly touching public surfaces like handrails or gasoline pumps. Wash your hands frequently with soap and water for at least 20 seconds. Use hand sanitizers that contain more than 60% alcohol. Cough and sneeze into a tissue or your elbow. Avoid touching your eyes, nose, and mouth. Avoid large crowds. When out in public, keep at least 6 feet between you and others. Finally, keep calm and try to maintain a healthy lifestyle. For more information, visit floridahealth.gov.
Nan and I were just talking about Passover, Peters.
Certainly that's all.
No, that is all. That is all. We were talking about Passover Seder's and how sad it is.
But you
I
haven't
can't tell you
and you haven't invited me.
Mayor, Mayor, I was monitoring them. They were. Here.
Bogan.
Here.
And Commissioner Rich.
Here.
Okay. We're waiting for a county administrator to come back up. I know that they're working as I speak to you, so they'll be up shortly. It's Walton. Yeah, Walton. Oh, next. Okay. I know. They'll be up. Okay. Okay, we will reconvene our meeting. Director Walton from Broward County Transit, you're up. I think you're probably the tallest person to work for Broward County. Huh?
Good afternoon, Mr. Mayor, Commissioners, and Administrator. Before I get started, first let me just call out and recognize the employees of the county as a whole. You know, I certainly represent the Transportation Department and want to put them out front, but, and you hate to single out any group of employees, but, you know, I have to give a shout out to our bus operators, because these men and women are truly the front line. And I can't overstate the cooperation that we've gotten from them and the Bus Drivers Union during this time. I mean, the cooperation's been great. I wish it was like this all the time, but I mean, they're out there, they're coming to work, they're out there every day with the concerns that are out there, and they have really shown themselves to be stalwart employees, and I just want to recognize them and make sure that all of you understand that, you know, that they're really coming through for us, they're really delivering. So with that, I just want to give you an update on what's going on with BCT. And as you might expect, we are seeing dramatic drops in ridership, both in the fixed route and the paratransit. If we compare our ridership in our last normal week, which is, let's say, the week of February 24th to last week, we saw a 37% drop in our fixed route ridership. If you take the last 2 days of last week, that ridership drop is over 50%. On the paratransit side, it's even more dramatic. Typical Tuesday schedule, we transport about 3,450 passengers. Today, we have 661 scheduled. It's about 20%. So the paratransit ridership has been severely impacted, and we anticipate that it will continue to be so. We'll talk about that a little bit later. But the ridership, of course, has created, and the corresponding revenue that we collect has been parallels that ridership drop, just straight in terms of percentages. One thing you should also know is that we have 147 bus order that's was being manufactured. We received 40 of those new buses, and they're in service. The bus manufacturing plant is on hiatus. They've stopped manufacturing, so we don't know when we'll receive the rest of those buses. But the good news is we have plenty of buses that are available to us to provide the level of service that we plan to provide. And I want to talk a little bit about how we plan to adjust our service to address the drop in ridership. Excuse me. What we are going to implement is what we call a modified Saturday schedule. And let me just explain what that means. A Saturday schedule typically operates about 70% of the revenue hours or the operating hours of a weekday schedule. The service span will be the same. We'll start service about 5 o'clock in the morning, and we'll end service about 12:30 in the morning. So the service day will remain the same, but we will modify the headways, and some of our services, some of the extra layer of service that we call the breeze service or the limited stop service that we operate on Federal Highway, on University, and 441, we're going to pull that service out. So the primary objective here, of course, is to make sure that the people who really, as you mentioned, Mayor, have no other options and are forced to use transportation, have a way to get to the grocery store, to the doctor, and to work. So we are going to make sure that that level of service stays out there for as long as we can make sure that the service is needed. Now, if we also have the ability to adjust the service. If we see late night service that on, let's say, if we're running service on a route that's running past 12 o'clock that doesn't need service, we'll make those adjustments as necessary. But what we want to do is make sure that we want to have enough service out there so that we're not overloading any bus. Our objective is to have our bus loading at 50%, because for the first time in public transit's career, or my career, or public transit history, we're encouraging people not to ride. You know, we're encouraging people, you know, to stay home. But if you have to ride, we're asking them to space themselves accordingly on the bus. And again, our objective is to try to make sure that there's no bus load greater than 50%. So in terms of this 70% schedule, obviously we won't need as many bus operators to do that. So what we have done, or what we are doing, is offering some of our elderly bus operators who may have underlying conditions the opportunity to take time off if they have vacation time, if they have sick time, and if they have reasons that they don't want to be exposed to the public. We're offering them the opportunity not to have to come to work. Additionally, there are other operators who have other child care or other care responsibilities that we're offering them that same opportunity as well. But at the end of the day, we work very closely with our bus drivers union, and they work very closely with us. And we recognize that the needs of the organization in terms of being able to provide that minimum level of service must be maintained. And they understand on a seniority basis, we would always have enough operators. So we, like many other transit properties across the country, have suspended fares, and we are going to rear door entry and exit. And that does a number of things. It actually eliminates the bus operator and the passenger having to touch the fare box. And it also eliminates or minimizes the contact that the passengers would have with bus. If they enter and exit from the rear door, they don't have to come past the operator, so it reduces the exposure to both the passenger and the operator. And that service, we actually began that last night. Now, there's a small percentage of our buses, some of our older buses, that don't have what we call you can't operate the rear door from the driver's control panel. But that's a minor modification that is being addressed. There's probably about 30, 40 buses, but that will be rectified, and those modifications are being done, and by tomorrow this time, we should have the entire fleet will have rear door entry and exit. A little bit about paratransit. I mentioned that we have seen substantial drops in our paratransit ridership. Most of the paratransit trips, about 50% of what is remaining, are dialysis trips. We are transporting people to adult daycare, and the rest are work trips. So I don't really know where the bottom is with the paratransit number. I mentioned today that we're at 661, where we're typically at about 3,450. But what we have done, which we thought was really prudent, was to work with our paratransit vendor to make sure that we're not multi-loading any vehicle. Each paratransit passenger is actually in a vehicle by themselves. And we've instructed our vendor to, after each passenger leaves the vehicle, to sanitize it and clean that vehicle. And that coordinates with what we're doing with our fixed route buses. Every bus, every day, when it comes in off the road, gets sanitized completely. We go through from bus front to back, top to bottom, going through touching or cleaning all the areas where they're commonly touched by passengers, all the handrails, all the seat rails, all the strap hangers, all the doors, any place that might be touched. And it's not only at night. When buses come into our terminals, we have people downtown or at our bus terminals who actually get up on the bus, clean the bus, and make sure that they do the same thing. They wipe the bus clean. On the paratransit side, one of the things that has worked quite well is that our vendor, again, has been very cooperative, but we've seen the dramatic drops in numbers of riders, and we had to negotiate a different rate with them because historically we pay them on a per trip basis. But what we really wanted to do when we worked with them was try to maintain some of the infrastructure in the paratransit system so that when the system does come back, we would have drivers available, because if we had stayed with the way that we currently pay them and operate the system in multi-loading, we'd have lost a lot of drivers and they probably would not have come back. So in an effort to try to stimulate the employment for the paratransit provider, we went to the single ride, which actually benefits, like I mentioned, the passenger as well as the paratransit vendor, because it actually allows us to employ more operators and keep the system intact. We hope that, like everyone else, we have, this is uncharted territory for us all. We're monitoring what public transit is doing across the country, and really nobody knows where this goes. One of the things that, and Director Mark Gale mentioned in terms of legislation that's being proposed, there's $20 billion that's in the proposed stimulus package for public transit. $16 billion of that is slated for urban transit systems, so we're watching that very closely. The rules really haven't been defined as to how much we will get or how it will be or what it can be spent for, but the industry is making the assumption that it'll be divided basically the way that the formula funds are divided through public transit. And the way it works now is funds are based on population, density, number of trips, number of miles driven by transit systems. There's a division for a region. So us being in the Miami region, we have a formula that when money comes down to our region, there's a four-way split between Broward County, Miami-Dade Transit, Palm Beach, and Tri-Rail. And we're assuming that any distribution would probably follow that same formula. Some of the rules that our national organization is advocating, typically, if you're an area of over 200,000 people, you cannot use those funds for operating. Those rules will probably be relaxed. But again, we don't have, it's not been, the bill hasn't been finalized, so we don't really know exactly where all that goes. But we're watching it very closely. So again, significant ridership drops as we anticipated. The service reduction, we will be watching that, and we want to maintain the flexibility because, again, we're operating about 70% of what we normally operate. If ridership continues to drop, we'll make adjustments, and we'll make you aware of those adjustments as they become necessary.
Thank you, Director. We'll start with Commissioner Rich.
Okay, thank you. Thank you, Mr. Walton. I'm really happy to hear a couple of things that you said about trying to adjust your pay, the way you pay, so that we can, maintain an infrastructure and hopefully the hardworking people that work in as part of those vendors. I'm totally not surprised about the drop because the truth is that the population for paratransit that you're talking about, should be staying at home. Elderly, people with medical conditions, disabled, so forth. So I would imagine that will, probably just continue to go down. But again, because I'm kind of proposing that with some other issues with nonprofits and how we pay, because we need to make sure that we can keep, as I talked before, as many people employed as possible, and then make sure that when we come back, we have the infrastructure there. So just wanted to recognize that I think you're going in the right direction, and I just wish you well. I know it's really hard, but thank you for your leadership.
Thank you.
Thank you very much. Commissioner Bogan.
Just thank you, Mr. Walton, for your work, and I have no questions.
Commissioner Udine. Commissioner Fisher.
I'm good to go. Thank you, Mr. Walton.
Vice Mayor Geller.
Thank you. Mr. Walton, perversely, I think it's good that we have this dramatic drop in transit. It shows that people are doing what they're supposed to be doing and staying at home. So other than that, I have no additional questions or comments.
Commissioner Furr.
Thanks. I appreciate the policies you're doing. I think they make a lot of sense, especially for the older drivers. That, you know, if they can take a leave for a little while, I think that's smart. Part of the surtax allows for, there's quite a places, and we talked about this a little while ago, of places where we can put people to work. And I know within that surtax is a building of a lot of bus benches. If there's a way of kind of expediting that, I think those are things that can be done fairly quickly. And I think, you know, there's going to be some people that don't have money to go Ubering around, or they're going to be. We may see on the back end of this more people taking the bus because they don't have an option. So, to the extent that we can make it a better experience, bus benches, those kind of things, make a big deal. I know we've got. I think went to like 1,400 that we were going to build or something. Something like, anyway, whatever the number is, it's a lot.
Right.
And there's a lot of places that are, you know, there's no cover, there's no place to sit. There's, you know, and people like, you know, they get rained on, especially in the summertime. The quicker we can get those out, the better.
Yeah, what you're referring to is the approval that you gave us in the surtax to build 75 additional bus shelters a year.
Right.
We didn't do it in 19, so we rolled 19 and 20 together. So we're building 150 this year, and that process has already begun. We're in the process of adding more vendors so that we can expedite it.
And my suggestion, and I know how many. I don't think that's enough. I'll be honest. If there's a way of doing way more than that, because some people they're not going to stand out in the rain to get if their bus stop is one with no place to sit down and no cover, they're not going to take it, probably. Yeah. And so, if there's room, if the budget allows, or if there's a way of kind of starting to move things around, given the way it is. This is one of the minor things that I think makes a difference and makes riding a bus a little more tolerable. If you could take a look at it, that's all.
Yeah, well, we can actually, make a proposal to you and oversight and have it approved by the oversight board to actually look at the out years and pull those forward.
Okay, good.
And we will do that.
I think it'd be a good time to do that. Thanks.
Commissioner Ryan.
To continue with what Commissioner Furr has alluded to with the surtax funds, perhaps it's possible at some of these locations you could have much nicer, I think, bus stops if you had more right-of-way. And I mean, there may be some locations where you have a bus stop that might be adjacent to a piece of property that for some reason is not being utilized. And maybe there are some opportunities for the county to pick up a parcel here and there and to have a nicer bus stop, because when you have like 3 feet of right-of-way, you're not going to be able to do that much. And that's what seems like what we have in a lot of our locations, especially along US 1. That's what I've noticed. And as you go out west, you see that where there's been more thoughtful planning, you've got the wider roads and more right-of-way, you can accomplish more. But a lot of our bus traffic is, 441 and US 1 and those areas. Those are the heavier traveled routes, Sunrise, Oakland Park Boulevard, Broward Boulevard. So whatever possibly can be done. I had commented earlier about how we wanted to keep moving with whatever capital projects we may be able to initiate or continue during these difficult times. Where do you see that in transit? What do you see as some capital projects that we might move forward with?
We've got some. We definitely need to build a third operating facility if we're going to grow our system. We're at capacity at our southern facility, and we're about 95% capacity at our northern facility. So for future growth, as the surtax plan calls for, we're going to have to acquire land and build another facility. Additional to that, the plan also calls for what we call neighborhood transfer centers like we have in Pompano, and like we're building in Lauderhill. We've got plans to build 3 more of those. Parking ride lots. We're actually building, well, the state is actually built, we're funding it, but the state is actually building one for us in Miramar. And there are other capital projects that are associated with the rail plans. We'll be coming to you probably in the next 60 days to approve an engineering RFP to look at the high-capacity routes in the county to determine where bus rapid transit should go and where rail should go. And that RFP will actually allow us to have the vendor and the contractor develop up to 30% plans so that we can, we have the plan, some of the early initial planning going on now. We'll be doing the NEPA as part of this study, and hopefully we can move those things a little faster. Typically, and if you're using the federal process, it tends to add a lot more time into these capital projects. However, in the surtax plan, it does contemplate at least one of the rail segments being funded by the surtax. So there may be the opportunity that we can move something more quickly with the first rail project.
We've always had a difficult time citing where we would have that third bus terminal, and we've had some locations that have been identified, and it always seems that the cities get very uncomfortable when we move forward with the plans, and I think residents get alarmed that it's somehow going to, I guess, degrade the neighborhood, when I actually think it's the exact opposite. By providing, that type of a depot, you have more opportunities to have that type of mass transit, in the neighborhood, deeper into the neighborhood, capturing a larger ridership. And I'm just wondering if there's ever going to be some way that we can change that paradigm and get some of our local partners to understand, what the benefits are of having that third facility. I mean, the one that we have in Dania Beach, because it's been there, nobody complains about it, and once it's there, it provides a great service. And this one, in fact, is right by where we have the Dania Point, and nobody seems to have any concerns about it. But it's just when you initially cite it that everybody gets so worked up. So, as we identify those sites, perhaps we could do a more of a concerted effort, and some of us commissioners could kind of like push the issue to see if we can get that third one cited, because it'll certainly allow the capacity. That's what you're looking for. Many, many more buses, and you're not going to be able to do it with 2 terminals. You're going to have that third one.
Right. And you're absolutely right. That has been an issue in the past. And what I, will share with you, when you look around the country, they're building these facilities now that other than seeing the buses come and go, you would never know that they're a bus maintenance facility. I mean, I went to one in Los Angeles a few months, about 6 months ago, and I mean, I knew what I was going to see, but it looked like just a 3-story structure. It was kind of set back. It looked nothing like a bus facility, and you would not know. And we've got many examples of that across the country. So maybe if I could share some of those with the municipalities, they'd have less angst about relocating or allowing one within their borders. But the facilities that are being built today, even the one at Ravenswood in Dania Beach, is more the way it used to be done. The more modern ones now, like I said, are very, they fit into the communities, and they don't look anything like a typical bus operating garage.
Commissioner Sharif.
Thank you, Mr. Walton. I don't have any questions. I think you're doing a fantastic job. Thank you.
Thank you.
Mr. Walton was a little disappointed that I wasn't able to include in his presentation his bus washing demonstration, and I would like for you to share that, not today, but we'll share that. I might not, and I think it's important that the public sees what is actually going on. They've stepped it up quite a bit, so we'll share that at another time. You feel better now?
I feel better.
Okay, thank you.
The inside or the outside?
The inside of the bus.
The inside.
Deep clean.
Yes.
It's what they do every night, so it's really interesting. Okay,
Yes, I do feel better.
thank you.
Thank you, Mr. Walton. Before you go,
It's like therapy for the day.
we'll continue the construction of the projects, especially the one in Lord Hill Mall that unfortunately I didn't get to attend the groundbreaking. I had other responsibilities elsewhere. But we're going to continue these construction.
Absolutely.
The other thing I have, Ms. Henry and Mr. Walton, in the last economic downturn, the federal government offered funds to communities that had shovel-ready projects. Are we looking to see if that's included here? And secondly, can we look to see what projects we might be able to move up quickly to get to that point of shovel readiness?
So the answer is yes. And I remember, I'm going to go back to 2008, 2009. There was a lot of competition for those dollars, so we ended up having to, pretty much use a lot of our own stimulus money to do that. But if we are able, and we have been successful. We just recently received was it about $14 million grant? $17 million grant. So we're on top of it. We're watching it, and every opportunity we'll grab it. So it's just something that we'll keep our eyes on. And absolutely, there are projects that we can take advantage of.
And if I could add, one of the things that's going on in terms of reorganizing, we've got a list of projects, capital projects, that historically we worked through construction management, and we're still working very closely with them. We're actually building the capital group in transit now because we should actually be building our own projects, and we're prepared to at the right time to transition some of those projects over, because some of them are in the design and planning stages now, so we can probably accelerate some of those projects as well.
So you think that will make you more nimble?
Yes.
Yes, sir. It will. It's okay to say yes.
Yes, thank you. All right. Thank you so much. We look to you for your continued leadership as our Director of Transportation.
So, Mayor, the last presentation that we have before I sort of do a wrap-up is our Human Services Department. And I always refer to Human Services as the soul of our county. These are the individuals, whether you're talking any time you have a community crisis, these individuals are the ones that are on the front line, and I really do appreciate that. So we're going to give you sort of a high level where we are, and thank all of our employees, because we know how difficult it is during these times, but these are the individuals that people look to. You all have had a number of conversations about how do we help, how do we direct people who are going to lose their jobs and the like. I could remember going through that same situation, and about 2 weeks or so, or 3 weeks, all of that, when they figured out that it's very difficult to meander and work through the federal government and or other programs where there's a huge backlog, they eventually make their way to our people at our family success centers in various forms and fashions. So they're gearing up. They know what's happening. They know it's coming their way. You'll see me directing quite a bit of resources to that agency, because we know that's where it's coming. Okay.
Director Mandy Wells.
Thank you. Mandy Wells, Acting Director of the Human Services Department. Thank you for having me. And just to probably underscore and highlight what Bertha just said, we continually are impressed with our staff and any opportunity that I have to publicly recognize the human services staff, I'm going to take advantage of that. These folks on a good day are looking after others and often not taking care of themselves, and that's on a good day. Right now, this is an unprecedented crisis, and folks are very scared and worried about their own well-being, and they're trying to take care of others. So just a major, major shout out to folks who are not only stepping up, but are being nimble, are being able to move, adjust immediately. So today I'm going to give you a verbal presentation. Our area is moving constantly. And so I'm going to go through a few items that I think will be of interest. The first is for senior services. And I also want to say we're very lucky and blessed to be in a community where we have such great collaborations and partnerships. So this certainly, human services is really, the foundation of it is with partnerships. So we don't do anything on our own, not only our own staff, but obviously working with the community. So the first amazing partnership we're working through to deal with the crisis going on with seniors is with our Area Agency on Aging, ADRC. Charlotte Mathis, who's the new CEO there, has been phenomenal. So we have been working at Elderly and Veterans very closely with her, not only in regards to getting information out to seniors, as far as what's open, what's not, and what additional resources are available, but we've been leveraging the EOC, Margaret Stapleton, and OPC to make sure communication is distributed very clearly. That varies from retail stores that have set hours for seniors to the information that Chris just mentioned about paratransit. Also, the big issue is meals and meal sharing. I'm going to go over a few things that we've shared recently that might be of interest to you all. And again, constantly it's changing. So we're working together very closely with ADRC. They are the lead, and we're offering support in some of the services we're providing. They've advised us right now all but 2 adult daycare centres have agreed to close. We do have 2 remaining centres that are electing to stay open, and we're trying to work with them and dissuade them. We are able to offer through Elderly and Veteran Services, through our funding, respite care, where agencies come in and provide respite care really to mitigate the idea of contact and mobility with seniors, to reduce exposure. We also want to make sure you're aware of what's going on with South Florida Meals on Wheels. They're continuing to operate. They've pivoted very quickly. They are now doing home-delivered meals. So seniors who would normally get meals at congregate sites, we're not doing that. We're actually mobilizing a huge group to deliver meals to folks' homes so they can still be fed. They do not have to be worried or anxious about getting a meal, and they can do it in the safety of their own home. So they're dropping off frozen meals once a week. Seniors who are not normally meal recipients, but they're getting food, they have food insecurity as a result of a number of things. ADRC has a hotline. They will do screens and determine if they fit the criteria. It's Monday through Friday. They're working closely with the state. Elder Affairs at the state level has been phenomenal to make sure that we have some coordination in regards to screening and then securing additional meals. And ADRC has done a phenomenal job. Partners at United Way have funded. We have private funders who've given that agency money to make sure our seniors really have access to prepared meals. Your Elderly and Veteran Services Division remains active and open. So I should have started probably by saying Human Services is open. However, we're adjusting and we're providing services in a number of different ways that we have not done previously to make sure that it's safe for our staff, and it's safe for our clients. So elderly and veterans are providing services by phone, and yes, believe it or not, Skype when possible. We're doing daily welfare calls. We are doing caregiver support groups via conference calls. We are also looking at making some changes in regards to some of the training that we provide to the community and doing that by Skype and conference calls. We're working very closely with the Department of Health. The Department of Health, as you know, are the lead on this, and they are the lead in regards to any assisted living facilities and skilled nursing facilities. That's not something that we do. We work, though, closely with them and ensure information is sent out to the community as quickly as possible. And the Department of Health has, as of yesterday, sent in strike teams to do some assessments, and a range of activities are going on at our local nursing homes and skilled living facilities. We have a myriad of items happening and constantly changing within senior services. Unfortunately, do we have everything we need, and are we catching everyone? No, that's just our constant daily challenge that we have to rise to. I would tell you local businesses, though, are also stepping up in regards to seniors. Walgreens and CVS are doing deliveries of medication. So we're also getting some of that information out the best we can to the community to make sure, and the big issue a lot of time with a lot of seniors is, because there's a lot of social isolation, is anxiety and fear. So when they can get a daily welfare call and we can find out what the issue or concern is and then help them work through that, or either deploy resources to them, that's something that we're committed to continuing to do. Our veteran services continue to remain active, providing services telephonically, and also we have someone embedded at the VA assisting our veterans. I'm now going to move on to the homeless continuum of care, unless there's questions about seniors, or just keep going. Okay, so the homeless continuum of care. So the homeless continuum of care, and I'll take questions at the end. There's a lot of challenges, and I cannot say enough about our homeless provider network that has truly stepped up. We have firm commitments. Our hacks are open. There was a bit of misinformation out, I think, at one point. Our homeless assistance centres remain open. There is some challenges with capacity. We are looking at the guidance from the CDC and enacting it in regards to social distancing. That really is a challenge in regards to the capacity of the hacks and the placement of just, in the residence areas of the hacks. There's daily calls with shelter providers, day respite providers, meal sharing providers, street outreach is still operating, and basically what we're doing is we're sharing information, sharing resources, and wherever possible, we're also using our leverage as a county to secure additional resources, whether it's through the EOC or through purchasing, who's found out suppliers have opened up with certain supplies that we can direct providers right to those suppliers, because certain supplies, as you know, in all areas are really in demand. We have suspended intakes at the HAC. We're working on reconfiguring the space. What we're trying to do is use the space a little differently to make sure everyone is safe, and make sure that if we have a situation where we need containment or isolation, that occurs. We are doing CD19 screenings at the HACs. It is verbal self-report. It's not a full medical screening. It is not a testing. And then we have a strong relationship with the Department of Health, and we're liaising with them. If there's someone who has a screen that is of concern or they show up with symptoms, then what we're doing is we're facilitating the call to the health department so they can coordinate testing.
And I just add, the health department is very, very focused on areas where you have a lot of people. So they will always prioritize. If we thought there was someone at a homeless assistance center that had some symptoms, they would always prioritize those, because they recognize it's a kind.
There's exposure.
Yes, it's exposure. So they've been really good at working with us on that.
So to date, I'm very happy to say we've had, to date, no reported incidents of COVID-19 in the shelter system. We are working very, very hard, and as are all the providers, to keep it that way, and to know that if we do face that situation, how we can have a plan of action so we can immediately mitigate and move someone to an alternative safe space where we have testing. There's no great answers in that area. As we speak, we're working on a couple of alternative plans We have an immediate plan for containment within the HAC system, and we're working with some providers that have some very limited capacity, and then we're also looking at what other options we may need to pursue should we need more than that. Day respite programs at LifeNet, Jubilee, and Hope South Florida remain open. Meal sharing schedules are being monitored and updated daily. There are continuing to be challenges, and we're working, as I said, a daily call with providers in regards to the accessibility of meal sharing and the providers' concerns in regards to staffing and access to resources. What I am thrilled to tell you is that providers are helping each other, and everyone realizes this is a real challenge. And that's also true for the shelter system. Real impressive things going on in the homeless continuum of care right now. So meal sharing, as I said, the meal sharing is continuing. We're doing no congregate meal sharing and doing meal sharing to go. Some of our other funders and partners, i.e. United Way, has also allowed to-go boxes. They donated a number of them to one of our NPOs so they could utilize them. And so this way it's dispatched to the individual, so we don't have large groups of people doing meal sharing. We're exploring some creative alternatives in regards to hand washing stations and also use of, mobile showers to try to mitigate and, follow health and sanitation guidelines the best we can. With the other update I want to give you very briefly is in Human Services. As you know, we do a public-private partnership. We contract with a range of community providers, not only to do our work, but those also are employers. So we want to look at it from both angles. We have a range of healthcare providers, and we also have a range of children's services providers other than our homeless network. Which we're looking in each of those areas, I guess really twofold. The first thing we're looking at is, we're doing some surveying, conference calling in regards to what providers are still open. Many providers are providing services remotely. There's some who are still open. Most of the homeless continuum providers are open. But there's been a lot of adjustments made in the healthcare system, especially with our Ryan White HIV programs. They're doing online certifications. I mean, people are being really smart and moving to a remote form of service. The teleservice is what it's called. The same with children's services. But we're looking further right now to see what other services, given the scope of the disaster, that we could add to those grants. So agencies, we can expand our capacity to do either outreach by phone, welfare checks and calls. So we're looking, because there's a lot of resources in that area. The other thing we're looking at is we're really committed to mitigate as much as possible the financial impact on these agencies. We do not want to contribute and add to the financial crisis that's going on with our NPOs in our community. So we're actively working on that right now to look at ways we can mitigate that. I mean, as you know, our grants are based on delivering a certain level of service. And in some cases, that's very easy. In some cases, that is not as easy. So we're reviewing that and researching that now, and we'll be looking at, within the scope of what we can do legally, what we can, how we can continue to support our NPOs, because they certainly are part of our safety net in the community. Some other things real quick in the HIV community as far as our Ryan White. We have extended pharmaceutical services to a 60-day dispense, extended our re-enrollment, doing it online, a recertification, the period of that as far as eligibility. We are also working closely with 211. Our providers are updating with 211 their capacity, what they're doing, what they're not. 211, I was just messaging with them. They have seen a significant uptick in calls and requests. In 2 weeks, they had 217 CD19 related calls, financial assistance primarily, and food. We're not seeing, with some of our front-facing agencies, the significant uptick, but we're also prepared for a delayed response, which is really what we think this will likely be. So we're working closely, with our provider network. The next area I want to give you an update on is what's going on with our rape crisis, child abuse services area, our child protection, and particularly our justice services area. We are continuing to respond 24/7. within the Nancy J. Cotterman Center. We are doing some basic verbal screens of all clients who are presenting for CD19, just for their safety and staff safety, working with stakeholders so they don't enter the building. And also, we've gotten some great direction from the Department of Health at the state about how to adjust our child protection team services to mitigate contact and to still respond to emergencies. So we actually have a really a great, very detailed protocol of how to respond on that. We have yet to see an uptick in those areas, but this is one of those things when there's times of stress, the issues of child abuse, domestic violence, and sexual assault usually go up, and so we expect that could come down the road. With justice services, we are providing all services as we were before as far as civil citation, juvenile predisposition. We're doing contacts telephonically. And clients and families are truly appreciative of that. And we are attending, right now detention hearings are on the phone, and we are attending, and they're looking to go to either a Zoom or a Skype, and we're prepared to adjust to either one once the courts issue that direction. I want to give you a quick update now on BARC and substance abuse services. What is being done over there is truly impressive. It's a large operation with a very complex and compromised population. They immediately leveraged their internal resources and implemented a full CD19 screen of everyone entering admissions and detox. They've done 356 screens to date. They're using their medical personnel there. They've worked with using the CDC guidelines and the Department of Health, of course. And the idea of this is just a pre-screen. It is not the testing. To know should someone be coming into that facility? Because as you know, your detox, we're housing, people are staying there for 5 to 10 days, and they're moving then from detox potentially to residential. They're going through and been sent up to residential. At this point, we've had 5 referrals to the Department of Health out of all of those screens, and they continue to be screened daily. We have converted all of our outpatient substance abuse services to Skype, and I need to tell you, the clients love it. It eases the issue. There's direct face-to-face contact. It mitigates the issue of contact. It also is more convenient. So we're doing that right now. All staff meetings are also Skype. We've issued social distancing in every area that is within BARC, so whether that's dining, all areas that's occurring. Suspended client visitation, minimized client passes, and vendors are delivering outside. So we're doing everything we can right now because all BARC services remain up and going, and unfortunately the demand is strong. We're at capacity, and actually we're seeing an increase. And we're thinking that maybe that is due to some of the other community providers that are either cutting back or are not seeing clients. So the last area for the update, to finish it up, is emergency assistance, and that is through our Family Success Center. So the interesting thing is, here is where we think that there's going to be a bit of a delayed impact. Right now, things are extremely quiet. People are very aware of what's going on in the community. They're following instruction and they're staying home. Our foot traffic is down. However, we do have some calls. We're doing online screenings. We have an online orientation, and we're doing. Clients have to drop off documents that we need to review for eligibility, and so we're minimizing face-to-face contact, but still reviewing those documents, and. We're doing some pre-screening. We're working within the parameters that we have. Our calls and requests are way down. Most folks are really, though, calling and asking about the stimulus package. So a lot of calls about unemployment. Where do I file unemployment? So we're directing them appropriately. But I think the big thing that really is impacting is, well, actually 2 things, and one is evictions are suspended right now. So once that changes, we will likely have a flood of requests. The other thing is FPL is committed to no disconnections, okay, for non-payment. Those are the 2 things that will certainly trigger our services. Right now, they're on hold. So we are seeing, I don't want to give a false sense that there's no impact. So we really feel that once that changes, or when that changes, that we will certainly, see an increase in demand. So that's my update.
Questions for Ms. Wells?
Yes.
I have, yeah.
County Administrator and Director Wells, let me thank you again, and the many employees of Broward County who our residents depend on so much. The county employees provide the backbone, the spinal column, if you will, of infrastructure and support for this county that keeps us functioning. And in this instance, ensuring that the least amongst us has some opportunities to live a full life. Again, let me say many, many thanks to all the employees of Broward County who have stayed on the job, who continue to work under these stressful situations as we provide the services for the people of Broward County. And my question to you is, in terms of the emergency financial assistance, yes, we don't see the numbers rise right now because people are pretty much staying at home. But I believe, Ms. Henry, that we need to look to see how we allocate funding, because we know it's coming. It's going to be a crescendo at the end of the day of needs within our community for support, that we look to see how we can move some funding in place to ensure that when this happens, we're prepared for it with staffing and with additional money.
So our whole goal is to try to the partnerships. It's all about connecting with those entities and making sure that we can take our dollars that we have and hopefully parlay them off of on other entities. These grants and a lot of these emergency grants, the sooner you get in and the more you show that you're able to match or exceed a match, the better it is for you to get those resources. So we know we're tracking it. We part of our review at this point, we obviously have to figure out how our priorities are, and as you know, families are stressed. So you'll have a lot of families with children, and so this is just something that it's difficult, but we'll be back if we need to.
Okay, thank you, Commissioner Ryan. We're going to change it around a little bit here, Commissioner Ryan.
I was very interested in what role family success is going to play going forward. And you touched on it briefly about reemployment assistance benefits, which is unemployment compensation benefits. The stimulus package is certainly going to have some funding for unemployment compensation. We're going to see in the coming weeks a large increase in the percentage of persons that are unemployed. And, if it's only going to be for 2 or 3 months, they can ride it out. But a lot of people, and we've said this from the dais a couple of times here this morning and this afternoon, don't have, 6 weeks or 2 months of savings to ride this out. And they've got to have just some money to put food on the table to make it through. And, even people that have 2 jobs, they may both, be unemployed, and it's going to overwhelm the system. If we could find a way to provide assistance to persons who want to apply to Office of Economic Opportunity for this reemployment assistance benefits, is there something that we might be able to do, and I, present this also to the county administrator, something that we might do utilizing some of our libraries or, in conjunction with what your folks do over at Family Success to assist people and doing the online application for unemployment or reemployment assistance, because you can't apply in person. You either have to do it on a computer or on the telephone. And when people are getting on the telephone, what we're hearing in our office is they're waiting hours and they're not getting, anyone that's picking up the phone. Even if they had a private call center where they could take the calls, take the basic information, and then call back, in some type of a queue. I think that, that's something that hopefully the governor's office will consider, hiring some type of a private call center to assist processing these calls. And, and also, if a mobile app can be utilized rather than have to go onto the computer in order to, file for the unemployment compensation. But for those who don't have the resources to do it, if there's something that we can do to assist that population, and these are the ones that are at greatest need, I hope that you'll look into that, and it's something that's going to be urgent. I mean, you see it on the horizon. You're saying it's quiet right now, but
It's
what's
coming.
right around the corner. And perhaps, County Administrator, you might comment on that?
So we're tracking those various types of requests. The state is at the table as a partner. So when they get to a point, if they can find an opportunity for us to be helpful for our residents, I'm sure they'll do that. I'll reach out to just make sure that they know that that's there, but we want to make sure that their infrastructure can support it. And I'll give some examples of some other things that we've done, but I'm hoping that, for us, it's all about our residents. So if we can do anything to help them, we certainly want to do that. But I don't know enough about
You don't want to overwhelm the state system in the
the correct. And then there's just a lot of
application process.
information that's, So we have to work with them to see what they're comfortable with, because a lot of things they're not.
All right, well, one other item that's worth mentioning is, it's kind of a seldom used program, but employers have the opportunity to use what's called short-time compensation program. And I believe that perhaps our Office of Economic Opportunity and Small Businesses and Mr. McDonald, I know he's familiar with it, where if an employer wants to retain their valued employees, but they can't carry them full-time because of all of the other constraints, if they will employ the person for between 60 and 90% of what their full-time salary is, then that employee can be working and at the same time apply for benefits for the reemployment assistance benefits. The employer has to submit a short-term compensation plan to the state. It is, as I'm told, routinely approved, and we can keep employees, have at least some employment, and employers won't lose their valued employees that they have already trained and are, an important resource to their business. And then one last thing I wanted to mention is I've been contacted by the Board of Realtors, and they may have contacted you also on a question of whether or not they can continue to do real estate closings. I would think that would be some type of an essential function. Obviously, most of the transaction you can do remotely, but perhaps, Renee, you could comment on that within the, the orders that we have delineating essential versus non-essential businesses. Are we able to continue to have real estate transactions take place?
So I received some communication on that as well. I am happy to put together an amendment or an advisory so that it's clear. Our issue was not so much closings, because if there were transactions in the queue, we wanted to make sure that they were continued. I think the bigger issue was having a lot of people showing houses, going into people's homes without really knowing where they're going. That was the biggest issue. But closings and things that can be done. My closing, I did a closing that the person wasn't even there. You went in, you signed, and you walked out. So there are ways for us to look at that and clarify. So if that's what the issue is, then, I can clarify that pretty easily.
Perhaps we could tailor some guidelines for that, because that is a significant business that's conducted every day
Okay.
here in Broward. So you'll work on, I guess,
I'll work with Ms. Harrod.
some rules or something that we can ensure that real estate transactions can continue to be closed. All right, thank you.
I thought that we talked about, I'm having a brain freeze now.
It's addressed in a couple of sections.
I
Drew, did you
thought
want to go ahead?
Yeah, please, go ahead.
I think Drew.
Yeah, I was just going to say that we've already actually given an opinion on this, that we worked with Rocio to draft. And one of the commissioners mentioned, I think, maybe perhaps it came through Commissioner Fisher, I don't recall precisely, but somebody in the real estate field asked, and what we said was, aside from the house showings, the rest of the transaction through closing, we believed fit within either the minimum basic operations up front or the ability to carry on business remotely. But since we're being asked, it would be very easy to have its own freestanding section covering real estate transactions and saying what's included in essential operations and what isn't.
And also, County Administrator, we had this conversation in terms of allowing the portal to continue to operate, to accept the portal for recording the transaction, the recording of the deed. I know it's done mostly online now, or can be done online. Wanted to make sure that there's assurance that that portal will remain open to allow for these recordings.
Oh, absolutely. And that'll be an area I address as a part of my wrap-up. If you want to, if any more questions for Ms. Wells?
Yes, I mean,
Okay,
I have County Administrator Henry.
let me go down the queue because we'll get confusing. Commissioner Beanfer.
Thanks. All morning, we've been talking about trying to navigate people to you, essentially, and to family success. And I know there's not enough people there to handle that. And kind of like what Commissioner Ryan was talking about, are you considering trying to redeploy some of the other employees in Broward County that way for a temporary time? Or what are your thoughts on that? How do you manage this kind of tsunami coming our way?
So as you well know, you all have gotten a number of calls from employees that why are we working? Why are we working? Why can't we go home? Why can't we go home? And the reason they're still working and the reason I can't send everybody home is because everybody, at the end of the day, they look to us to support the community at this time of need. So believe it or not, we're using some of our librarians for assistance. We've used some folks at our parks. We have people with skills. We have a skills bank. We know what their skills are, and as things step up there, we're able to move our employees with the right skills to help where they're most and best needed. This agency, I think, has done a really good job of, as all of them, all of county government is open. We're just trying to find a different way to do business because my challenge to all of the agencies is that we're not closing. We are not closing. So if we are going to limit foot traffic, then we need to make sure that we have a virtual way, telephonic way, other ways to make sure the public can reach us and can get to us and we can deliver those services. There's a myriad of them that we are assuring that whatever we did when people could walk in, there's another way for them to perform those services.
Can I just add?
Yes,
So the other thing is we already have an excellent partnership with OPC that runs the call center, 311. And so they are already taking some of our calls. I mean, we're being creative. So at whatever point internally we are overwhelmed with calls, we certainly will be working through partnerships that we already have in place to make sure it's seamless. We're not there yet, but they already take a lot of our
Are you getting a sense yet of what the waiting time is on those calls?
For 311?
Yeah.
Oh, the waiting time is, I believe, less than a minute. Margaret could answer that, Margaret Stapleton. But their response time is phenomenal. Okay. Phenomenal.
For
instance,
like
for all of their calls. For all of their calls.
Let's say they're calling, they're wanting to apply for unemployment, or they're wanting to apply for SNAP or other things. Then.
That's
three-
a different call center.
That's
That's
a-
not
oh,
really
okay.
kind of.
So that's
not-
211,
I was
Yeah.
thinking that was-
yeah, which is external. That's
Okay,
a
so the
Yeah.
nonprofit.
So the time wait on 211,
I don't know the time wait today on 211, but I can get that for you. They're the agency that are the general information and referral for the community, nonprofit external provider, one of our funded providers.
Right.
And so I can get the call time. I know their volume has gone up, but there's also conversations as of today about how 311 can get information and divert some calls to help 211. So there's a lot of things that are very, it's really fluid right now in regards to, as I think Bertha said, who has the skill bag not only in the county but within our partnership network, so we can respond at whatever point we need to. So at whatever point, we're not seeing an increase in call volume yet and demands for family success yet. We're working on plans of how we would manage that, how we would have to grow our capacity internally within the county and then potentially even with external partners, if that's what it would come to.
well, if we are trying to drive traffic that way, if we are asking the airport and the seaport to, work with those employees that have been furloughed or suspended, then we're going to have to, simultaneously be making sure that we can handle that traffic.
Yeah. Yes,
And
yes.
that's my point.
Yes.
If we're talking about, I think if Stacy was talking today about 92,000, I don't know how many normally go through there, but it's not 92,000.
No, certainly. If we were to expand the scope of the program or
Right.
target we currently serve county employees. You just have to be a Broward County resident, so
Right.
we currently do. But if we market it under these circumstances to large employee groups, we would have to absolutely figure out what was needed and how we could ramp up and how that would look and what's the best way to do it, because it may
Right.
not be the same way we're doing it right now.
I mean, we may have to go mobile or something, because having everybody try to go to West Park, or we have 4 centers.
Yes, we're doing phone assessments at this
Yeah,
point,
and
but
and-
it would overwhelm the phone system.
It would be. So it's a challenge. But I know we've got the people that can do it. It's
So,
just-
so right now, a lot of our 311 phone capacity is being utilized by the health department to do screenings for COVID-19.
Okay.
Believe it or not, they trained a number of our employees, many of them, they have a different phone number. They're not calling 311, but they're using our phone equipment. And obviously, we're having to do social distancing, which means I don't have as many at that point. But we're looking at making sure that we balance out where these resources need to be. We began with our call center helping the health district with 22 calls. We're up to 1,187, where we are actually doing assessments. We've assessed and referred people for testing based on the way they responded. So we'll be a little creative, as you can tell. One of our contracted call centers
Right.
are not taking as many calls, so we're working with our ETS to understand what the infrastructure might look like for something like that too.
Okay. And my concern on that is, I know this is almost overwhelming, but all of us, I think, have gotten calls of people having to wait 3, 4, and 5 hours to talk with the health department. And I know, and that's at a time where they're at their most stressed. So.
We took some pressure off of them.
Yeah. And I guess I'm hoping we can continue to take more pressure off where we can, and where we're dealing with it on unemployment, because that's going to be high stress. And if they run out of food, even more stress. So to the extent that we can kick into gear there, it'd be good. Thank you.
I can tell you that I called that number yesterday myself, the 954-357-9500 number. And the call time, according to the recording, would be up to 5 minutes. The young lady that came on was very proficient, professional, and courteous. So whoever it is that
She's a
heard this
Broward
voice,
County employee.
so whoever it is that heard this voice yesterday at that number, know that I am complimenting you for the very good job you did. Vice Mayor Geller.
Nothing at this time on the social services.
Commissioner Fisher.
Thank you, Mayor. I don't have any questions on the Human Services. I want to thank Ms. Wells for her very detailed report. Amazing job.
Thank you.
But I do want to talk about what Commissioner Ryan spoke about most recently, was about the Board of Realtors issue. And I have been diligently working with Adam Sanders. Yes. So, but I'm concerned still about the issue with the Board of Realtors, and Commissioner Ryan kind of got to where we needed to be, I believe. I just want to confirm two things. Number one is that obviously we can continue to do transactions as realtors. There's about 10,000 transactions pending worth about $5 billion. And in working with Drew, I don't think there's an issue there. So just confirm that if you would, number one.
Confirmed.
So they would be essential in that aspect. The only other hiccup that we do have is the fact of property showings, and I can understand the theory of not wanting to congregate and have folks in homes or whatever, but if there would be some way to work out, Drew, whether the owner gives permission to let one in their home, whether it be one person at a time, et cetera, but no one is going to purchase a property without seeing it. And so if you don't have some type of opportunities for them to do so, that will extremely stifle the real estate industry. So I don't want to go there. So is there any way that we can work on that aspect? We've already made them essential on transactions, but can we work on the showing aspect where there should be some rules and regulations to do so?
Commissioner, that is purely a policy decision where the board during this workshop should express its consensus to the county administrator, and the county administrator is empowered to make those choices, understanding that there's going to have to be a certain amount of reasonable line drawing that occurs, and it's a difficult question. What you say is very true. At some point that'll dry up if there are no showings. So it would be part of a very good discussion, and then whatever the consensus is and whatever Ms. Henry ultimately decides to do, we will carefully draft it and hopefully make it very, very clear.
Well, if I can get the board's consensus on that, I would like Ms. Henry to work with Mr. Sanders in coming up with a solution that would work for all.
Commissioner Udine.
Hello?
Yes, is that Ms. Henry?
I'm just trying to put it out to the board, Mayor, that if we can get consensus to at least have Ms. Henry work with Mr. Sanders and trying to come up with a solution for the showing.
So as we go through the cycle, each commissioner will have input.
Okay, Mr. Mayor, that get back to me.
Can we get back to Human Services?
Yes, if I might, Ms. Wells is still standing here attempting to wrap up the Q&A on that, and then we can pivot over to the other outstanding issues.
So if I may, I think Commissioner Furr wanted to address Ms. Wells, and I still have Commissioner Sharif, Commissioner Rich, that hasn't spoken on Human Services.
Mayor, I haven't spoken either. Mayor.
Okay, I'm sorry, Commissioner Bogan. Go ahead, Commissioner Furr.
For the safety of the employees, because I know a lot of people will be coming into the Family Success Center, I wonder if it makes sense for us to get some of those infrared thermometer things. Have we thought about that? Where whoever, and like in all of our libraries, we have security people. Is it worth? I don't know how to do that.
So actually, what we
how
were,
do we do that?
what I will have a conversation with the health department about that.
Okay.
Because I don't
I don't know if it's
I
the
can't
right-
speak intelligently about that
Me
at the
either.
moment, but one of the things that we were talking about was managing the crowds through reservations.
Right.
So people, even if they walked up, if they give us, and most of them come with their cell phones, if they sign up and we can manage, so we don't have large crowds and
Right.
we can create all the separation that we need. If there's some other way to look at that, I'm happy to look at it. But we've been thinking about that and we are concerned about that, and we feel that there are a number of ways for us to separate our workers.
I mean, I think even when when the curve starts to bend and we open libraries again, coronavirus it doesn't just disappear.
Of course.
And we may want to have something in place where we can kind of at the very least, take a temperature or whatever, that can kind of be somewhat of a screening. I don't know if that's the right thing to do.
Okay.
And we should be asking the health department on this. But the second thing is, and thank you with the stuff about the eviction stuff, I had actually, and I pulled it from the last, I had done a supplemental FPL asking for a resolution to defer all
Shut-offs.
shut-offs
Disconnect.
through the month of April. And then I
Yeah,
called
that's it.
them and they said, don't worry about it, we'll take care of this. And so I pulled it,
Okay.
just so everybody knows that. And that's through the month of April, at least up to this point.
Yes.
Commissioner Sharif.
I am a little bit, I feel like we're maybe a little behind the eight ball on some of this because people live paycheck to paycheck. I don't know anybody that's in the regular working class that can go 2 or 3 months or even have 2 or 3 months worth of savings to get through this without being paid and continue to feed their families and pay bills. I don't know what a $1,000 check is going to stimulate for anybody, but I would say that most people bring in more than $1,000 in a month for their wages. So if they're off a month, you give them $1,000, that's really not going to do much for them. And that, I know the 1,000 is not coming from us. It was something that the president issued, but I'm just saying, like, I think we need to be prepared on a higher level for people not being okay, and that falling on the shoulders of the county. And then, like, you know, what do you do when you have a family of 4 that can't feed themselves? And are we prepared for that? I just don't see where we're going to be, and I think we're going to need more assistance from the federal government as well as from the state of Florida. This as well. And thank you for doing a great job with what you have.
Thank you.
Commissioner Ridge.
Mr. Mayor, I had waived my time earlier. If you could call on me at the conclusion, there is one thing I wanted to say.
Okay. Commissioner Ridge.
Okay, thank you. I just have a few things I'd like to add to some comments that Mandy made with regard to seniors, and a couple of other things. I want to thank Mandy and all of the people who work within Human Services. We have an amazing group of people that are so devoted and really believe in being humane and caring and compassionate to people. So I just want to thank them. I just want to say, in particular, Rebecca McGuire, who heads our homeless continuum of care. She has done an amazing job with her updates and having calls every day so everybody knows what's going on and people can help each other. And I think that's really one of the most important components here, because what I hear sometimes is, it's not coordinated, we don't know what's going on. And I think there are a lot of good examples out there exactly to the opposite. And the Homeless Initiative Partnership would be one of them. So I want to just thank them for all that they do. I also want to move over to seniors quickly, because there's been a lot of conversation about, certain services that are not having additional people coming to them right now. One place where people are definitely going happens to be in the senior services arena. And I want to mention that because it was mentioned by Mandy that, many of the meal sharing programs are closed because the senior adult care centers are closed. That puts tremendous pressure on the Meals on Wheels program. And I want to say that the collaboration with everybody from the county, ADRC, United Way, Meals on Wheels has been amazing. Just to let you know, we delivered, back on the 19th of March, we delivered 364 meals. These are just, people that weren't, that now are no longer able to have their meals in a congregate setting. And today, the number of meals that we're scheduled to deliver are 2,254. So you can see the impact that the closure of the senior centers has on the Meals on Wheels program. I want to thank specifically United Way has been amazing. They have given contributions, grants to 7 agencies, including the ADRC, the Urban League, Hispanic Unity, Jewish Family Services, Healthy Mothers, Healthy Babies, LifeNet for Families, Light of the World Clinic, given that significant contributions to them to provide emergency assistance to families. And in addition, ADRC for Meals has gotten significant contributions from Humana and from Ultimate Software. So I just want to thank those people for stepping up. I also want to say that we have another really great example of collaboration and coordination, and that is our Coordinating Council of Broward. The partners are now sending relevant information, timely information to Sandra Bessie Einhorn, who's our executive director, and she is doing an unbelievable job of coordinating that and getting it sent out to on a very regular basis to all of the partners, so that everybody can actually know what is going on, whether it's with the hospital districts, whether it's the school district, whether it's the county, whatever human service agency it is. And I think that that's really been a wonderful addition for people to know what's going on. I want to just bring up the question about, Mandy did mention about looking at how we're paying our providers. And this is of great concern, I think, our county human service contracts. And there's been a significant change taking place with many of the other providers and how they are determining now because of this, the emergency circumstances. So for me, I understand how our contracts work now, and I have no problem with it in an ordinary circumstance. But the CSC, United Way, the school board, ACA, Agency for Healthcare Administration, and the Agency for Persons with Disabilities, which is not exactly known for its flexibility, they are now have changed the way they're billing, and some of them are doing an average of recent monthly billing, and some are looking at some other possibilities as well. But I think the goal is to allow us to keep people employed so they don't themselves become dependent on an already, overwhelmed safety net system for food, for rent, and other things. And it's also, I think, to preserve the overall community safety net infrastructure for when we get on the other side of this pandemic. So I'd like to, just urge, and Mandy might want to comment, but I think we need to really move ahead on this as quickly as possible and to look at, and I know you started meeting with some of the providers, but I would just want people to realize how important this is to have flexibility, and not only just to deliver services by telephone, because every provider is different and different things are happening. So I think we just really need to understand that we have to, do something in light of the emergency circumstances. I don't know if you want to comment on that. But.
I can, as Ms. Campbell and I have had conversations about this. We've indicated that that's something that we are prepared to do as long as they are open and providing service. And when I mean open, they don't have to be physically open, but if they are providing services to the community, we're willing to look at it.
Okay, and I
And we'll
just,
be
you know,
making-
hope that we can do that relatively soon
Yes, ma'am.
for them. Yeah, okay. And the other thing that I had mentioned was we've already discussed a little bit, just a reminder about the residential care and connecting with the hotels on that to make sure that maybe we can help in that coordination of that effort. And lastly, I just want to urge everyone to please, whenever you're out, whenever you're maybe not out, but you're talking, you're online, whatever you're doing, we need to make sure that people are answering the census. I mean, this is critical to our community. When we look at what's happening now with this pandemic and the emergency response system and hospitals and healthcare, we can see all over the country how, we are not prepared. The census is just so critical because it's how we draw our money down. It's how we get our fair share. And we just have to keep reminding that. We're doing that with the school board right now. They're passing out laptops. We're giving out, postcards. We're going to be at their feeding programs next week to pass them out. And any opportunity that anybody has, you can call Naomi at her office, Naomi Labate. She's heading up all of this for the census. And we have postcards. We have things that can be passed out so that we can really remind people that how easy it is to just go online and get this done. Okay, thank you.
Commissioner Udine.
I think that everything you're doing, I mean, I've been in awe of what you and Kim Campbell, since I got here 3.5 years ago, what you guys do day in and day out in your team, and I'm especially grateful for what you do now. I think that your department is going to be the one that's going to explode over the next few months, and I'll do whatever I can to help. Just let me know, and I'm there to support you.
Thank you.
Commissioner Bogan.
I want to just echo my fellow commissioners saying thank you for doing such a great job, and I have no questions.
Vice Mayor Gallo.
Thank you, Mr. Mayor. What I had been planning on saying until some news came up is I have been concerned about the food situation for a lot of people. And when Dr. Sharif was talking, I agree with everything that she was saying. And I have been concerned and have, in fact, raised this to the administrator that, we need to be careful because all of us on the commission have a reasonable net worth, pretty good salaries, that we are taking care to make sure that, the people that, are working paycheck to paycheck are going to be able to meet their needs. I'm particularly concerned about the issues of food. I've raised this concern on other issues such as making sure laundromats are open in the emergency order, pawn shops, other things for people that don't have checking accounts, etc. While we have been on this meeting, and the reason I didn't raise this earlier, but after Dr. Sharif made her comments, at least the Senate Minority Leader, Senator Schumer, has indicated that the package that they are discussing and that they appear poised to pass would cover 100% of salary of people for up to 4 months. If that is true, that will go a long way towards alleviating the concerns that a lot of us have expressed, and that I was going to express earlier, but have not based upon the fact that, if true, that will, as I said, alleviate many of our concerns. We can only hope that what Senator Schumer has claimed will occur will actually occur. Thank you, Mr. Mayor.
Okay. Well, thank you very much, Ms. Wells, for your presentation and for your continued and diligent work. I know it's trying times and you're putting a lot of extra time in, and thank you very much. And thanks to, again, all of Broward County employees for stepping up.
Thank you.
County Administrator.
Again, thank you. You've heard a lot. I'm going to try not to be repetitive, but I think it's important once again to emphasize that we're still here. We're still providing service. We may not have the foot opportunities for people to come in the way that they used to, and we're discouraging that to the extent that we can. But we do know that there are a few operations where that's just not possible. So wherever we can do services virtually, we've done it. I know that many of you, and I've gotten the same calls and concerns about our employees who are not comfortable. They want to be at home. And I have said to each and every one of my directors, if there's an employee that is uncomfortable in any way, shape, or form, let them go home. If they have leave, we're being very liberal with the way that they use their leave. If they have it, they can use their leave and they can go home, because, to sit when others are really trying to, they've got a lot of pressure on them, and then you have employees that are just unhappy and uncomfortable for whatever reason, and we don't know all of their circumstances. A lot of it may be legitimate, but if they have to leave, we're being liberal with that, to allow them to do what makes them comfortable. We have, there was a lot of questions about telecommunications, and hopefully by now you can all appreciate that when you have an organization that's $6 billion, you're the target. People are looking at you. We're distracted, we're vulnerable. So we have to make sure that our systems can handle people telecommuting. And so my security folks, there's nothing that is 100% secure, but they give me an assurance that if we have three things: first, that it's a county issued equipment, and that and employees are not downloading other things on that. And when we've given you a county issued computer, we have said, do not download other things on that computer, because then you make it unclear. It's unsafe. Then we have a VPN, where it's a virtual private network where you can go in, and it's almost like a ghost system. But a lot of places are using it, and so the people that can hack into our systems have figured out how to get around that. So then we added third-party authentication. So that means when you want to get into that network, we contact you by other means to make sure it's you trying to get in that system. So unless you have all of that, we are not allowing people to telecommute, because it creates a vulnerability. Now, I'm up to 1,200 employees, about 1,200 employees that have all three pieces. And so we're allowing that where it can happen. But again, my first priority at this point is to make sure people don't get into our network, and with all of this going on, bring it down. Nothing's 100%, but we're doing the very best that we can. Fortunately, the state sees us as a region, but now I think we're all seeing ourselves as a region. I got to tell you, when Miami-Dade or Palm Beach takes an action, on either side, if we take an action without it's like anything else. Through social media, the word gets out, hey, Broward parks are open, so everybody comes to Broward parks, or whatever the situation is. The marinas are closed in Palm Beach, and marinas are closed in Miami-Dade. Broward marinas are open, they're coming to our marinas. So clearly, we are now firsthand understanding the ramifications of seeing ourselves as a region. So without getting into all of our closures, as you know, we're putting information out to just let you know what we're trying to do. I understand some of the angst that a lot of the businesses are having. I was glad that the sheriff said what he said. Our goal is to educate. These things are coming fast and furious. There's absolutely no way that people will know. And so we're trying to push it out and push it out and push it out, so eventually they get it. But On the backside of me, I have the health department. Why, they want to see more things shut down. They want to see more things shut down. They're sounding the alarm. So anytime, we see an opportunity so we can try to reduce people riding around or moving around and congregating, unless we can, there's a real justification for doing it, we're having to do that because if you're like me, if you get up at 5 and you're going from news channel to news channel to news channel, I'm business, I'm on all of it. It's like the people are still not heeding the word. They're not getting it, and our young people are invincible. We all know that. But I'm hoping that over time they understand that there's a limit to invincibility. So I am just extremely grateful to the employees, for as many employees that have raised concerns. I've had a number of employees that we understand and they're there. And so that balanced it out, because when we took on the responsibility of being here for the community, we're like those doctors and those nurses out there on the front line. And we're trying to make sure that our employees understand that the community needs us. We're going to do our very best to protect them. Mr. Hammond is here, and we're talking more and more about any and everything else that we can do, just on a constant means of making sure we protect our employees. This is going to go on for a while. I'm trying hard not to burn everybody out because we're going to need them for the long haul. Whether we flatten out and we have to try to bring this economy back in any way that we can. So right now it's just more of I appreciate you all taking the calls. It's happening so fast. As soon as we get it, we push it out. But sometimes we may miss a couple, but we're doing the best that we can. And now I'd just like to answer any questions that I might be able to answer.
Okay, so we're going to go in order, starting with Commissioner Sharif, and we'll go by district down to District 1. Commissioner Sharif.
Ms. Henry, I've asked all of my questions. I think you and your staff do an exceptional job. I had stated my concern earlier, and I just think that we just need to be prepared for many of our Broward County residents to come forward with financial difficulties and food insecurity because they just don't have the money. And I am concerned with that, and that is my only concern today, is that I don't believe that we have enough resources to accommodate them. Senate Commissioner Geller and Vice Mayor Geller, I appreciate the comment, and I hope that Schumer can get that through, because that's going to send some much-needed relief to the workforce in Broward County. So thank you very much, and I'll be listening for whatever else you guys have to input. Thank you.
If you can make this your final comment or your closing comment also. Okay.
I'm tired. That was my closing comment.
All right. Commissioner Farr.
Thanks. I know this isn't really in our ballpark, but do we have, having to do with hospital beds, and I think we all have to be looking ahead like that. Have you been in discussions with the hospital districts? Because I know we work with them, but are you hearing from them what their needs might be, and is there something that we should be doing to be helping on that?
So fortunately, it appears that the state has designated our area for a field hospital should we need it. So all the plans, everybody's putting all the plans in place now so that if, in fact, we have to activate that we would. But at this point, that's the only thing that I'm aware of. But as we have more and more dialogue about their guidance, because they're really trying to not have people come into the hospital unless they really, really are sick. And having the guard here already established, if they need to throw up field hospitals, that's a good thing for our community.
Okay. And the shortages that we're hearing of, like the mask, like all that kind of stuff, has there been any thought about trying to redeploy manufacturers? Have we been asking, or can we do that? Is there anything that we can be asking our local businesses to do on that?
So, and I think he said it, there, a lot of them are looking for ways to really help in that regard. We get phone calls all the time. We try to find the backdoor way to get the resources that we need. And in some instances, we've been successful. In some instances, not so much. Or you can, but they'll be there, but the backlog is such that, if you need it right away, it creates. So we just get in every queue that we could get in, and hopefully something breaks, a dam breaks, and we can get the resources that we need. But it's hot on everybody's agenda, whether it's through the Department of Emergency Management at the state level or the local level. And I do think that communities will sort of rally around each other when they see that things are getting even more desperate.
Because I have seen other communities around the country that were used, like for those masks. A lot of the same masks are actually being used by painters, the NP5. So you go to Sherwin-Williams or Benjamin Moore. I actually saw some there. I'm like, what are these doing here?
No.
And I just wonder if anybody's contacting construction sites, et cetera.
They are.
Okay, great.
They
are.
Good.
The next one is with regard to communicating, like we had to have a meeting to do this today. And I guess this goes to you, Renee. Given the relaxing a little bit of being able to discuss things like this, is there any way of doing like emergency calls together? Is that?
Sure. So Drew, I'll take it unless you want to.
Go ahead.
So the only thing that was modified in that executive order, I think you're referring to, Governor, was the in-person quorum requirements.
Okay.
All the remaining requirements of the sunshine would still apply. So the same advice that Drew's given you in the past in terms of those type of calls would still apply.
Okay, so that's the extent of that.
But we could have a commission meeting without any commissioners there, like I suggested several times.
We heard you. Several
Right.
times. Several
I'm with
times.
Commissioner Furr, you were referring to participation in like the state's or regional emergency calls. Is that your question?
What I was trying to see if it was easier, because I recognize every time the county administrator's having to put out an executive order, she's having to call each one of us and then if there's changes, she has to go back and call everybody again, and I can only imagine how cumbersome that is. And I was trying to see if there was some way of making it less cumbersome, but it doesn't sound like without.
One way of potentially doing it, if there were very substantial changes, or material changes, is the mayor, and I don't have the rules in front of me, but at least the mayor has the right to call an emergency meeting. So if it was in response to an emergency or conditions under certain circumstances, then the emergency meeting could be called, and because of what the governor did in terms of not requiring a physical quorum, that could occur by telephone conference, but there would have to be the ability for the public to at least listen to it, even though you cannot have public comment for that.
So if the county administrator was needed to do another executive order, the mayor could call a meeting. We could all be on telephone. Obviously, the press would be on the call as well, and the public could be on the call. But that might be a way to facilitate that and make it, because I was watching you try to get through the last executive order, and I know it was taking a lot longer than you probably wanted. Because I knew it took time to go back and forth between 10 people and 10 different ideas. So given that, my suggestion is if we need to do that again, that the mayor calls a telephone meeting to facilitate that, so we can do that a little quicker, and that would be okay.
And And Commissioner, it's going to depend on the facts and how material it is and how critical it is to respond to something that's emerged that needs to be addressed right away, because we don't want to be accused of circumventing the regular public notice requirement by declaring emergencies too often. So unfortunately, it may be of limited utility, but under certain circumstances, that is a tool we have in the box.
Right, it has to be justified.
And I'll work with administration and the county attorney as we need to.
Can I just ask a question on that?
Yeah,
Go ahead.
it's fine.
If we've already designated the county administrator to sign the emergency orders. We don't need to vote on that. She can sign whatever emergency order she determines is in the best interest.
Absolutely correct.
She is simply giving us information when she signs one and asking for different opinions, but we don't vote on it. She can do whatever she wants with that at this point.
Correct.
Why can't it just be on an email to everyone? If we're not voting on it, it's not a sunshine issue.
Well, I think that she is giving us a courtesy on that.
Right, I'm respectful, but what I'm saying is, why can't the county, how could that be a sunshine law if we're not voting on it?
So, Commissioner, your question was in terms of whether the county administrator is authorized to issue the emergency order.
She is.
certainly
We've already
is.
given her that. She can do what she wants.
She certainly is.
I appreciate what she's doing. She's giving the courtesy to, like, what are we hearing in the community as she does this order that we've already voted on, that we're not voting again on it. She's got it. She can do it. I want her to be able to do it. Why can't she send us an email, and why can't we hit reply all?
Commissioner, she can send you an email. Under many circumstances, a reply all would be appropriate and would not violate sunshine. However, there are still actions that this board can take, including and foreseeably would take, that would cover the same subject matter, including something we may be bringing for March 31, just to button things down a little more in terms of a potential emergency ordinance that we're working on right now. And we just think that it's better to be careful with these things than not to. But you're right. A lot of that would be fine to act that way, to proceed that way.
So I'm just curious about standing over process on things that need to come out fast. I don't want the county administrator to have to make 10 calls and then call back 10 times and it multiplies. Even if we could somehow be considered close to the sunshine law, which I don't think we would be in this case, but I respect your opinion, we could simply cure that before any time we ever took a vote. If there was an email that went replied all, here's what we talked about, here it is, we've spoken about it, it's done.
Well, I'm a little more conservative on that. And also, as you mentioned, the county administrator can take this action and is empowered to do it. Right. So I would think in most circumstances, especially now that a lot of the larger items have been resolved, and as we're at the tweaking stage, those sorts of things she would probably do and then inform. For very substantial items, it may be more appropriate to have some sort of an emergency meeting or for the board to provide, or a special meeting on relatively short notice for the board to provide its input. But we have to look and see what the specific issues that are being addressed, and I promise you we will be less conservative with sunshine than we normally are, but we're still somewhat conservative with it.
Okay, Commissioner yeah.
Almost done. Are there any additional testing sites planned that you know of?
There's discussions about a couple more, but they're not, I wouldn't say that they're in the planning stages at this point. Or at least they haven't indicated to me that they're in the plans. We have an agreement with the Department of Health for points of distribution. They use our parks because of the size of the parks and the logistics of moving through the parks. I have had requests from, for example, the hospital, one of our hospital districts, and that's not specifically tied to the state at that point. So when they asked to use one of our parks, I said, time out, that's a park that I have an agreement with the health department. So if they concur, then we're fine. So at this point, they haven't, I don't have another specific request, but I understand that there's a couple more being contemplated, as I think the mayor mentioned one. But until I have something really specific to work with, I'll
Okay.
be a little bit more.
I've got quite a
Circumspect
few
on
more,
that.
but I
No,
can,
go
I can
ahead.
do these directly with you.
Okay.
I do want to thank staff for all they're doing, and all of Broward County staff. And
They're
it's-
wonderful.
Yeah, they're amazing. And it's amazing how the term essential has changed in the community in general.
Yeah.
How important a grocery cashier suddenly becomes, or a sanitation person, or all right down the line. The number of people that have kind of keeping things moving while we're going. So
Every now and then I'll get a call on the weekend from a resident. I'm not expecting to get it, but there's so many, we're working, and there's just so many calls that you're trying to make sure you respond to and you grab it. And it's somebody desperate on the other side of the line, asking you to do certain things. And once you explain, they're like, oh, I didn't think about that.
Right.
So, yeah.
So thank you to everybody who's working really hard on this, and hopefully, if everybody kind of stays out of circulation a little bit for a couple of weeks, and that's kind of what
That's a big push right now.
That's-
It's like,
yeah.
what else can we shut down to get people to stay home for a couple of weeks?
I mean, if anybody's watching and watch what happened in China or Italy or wherever, it took that couple of weeks of everybody staying home and letting the curve bend a little bit. And so hopefully everybody will do that. And I think your order was on point, and I appreciate it. And I think we all have to do our part. So thank you.
Commissioner, on the issue of the hospital needs, one of the things that I was told is they need more testing kits. Broward Health had to close their site in Sample Road as a result of not having testing kits, so they're hoping that I'll get some soon. And once they do that, they told me they'll work with me to get another site in. Central counties, there's nothing in Central County as it is right now, nothing. Vice Mayor Geller.
Thank you, Mr. Mayor. A couple of items. First, I'd like to congratulate you. As I've been watching TV, I've seen you everywhere, so you're representing the county well.
Thank you.
And while I'm thanking people, I wanted to, again, as I said earlier, I've spoken with Monica, I've spoken with Bertha, I've spoken with Drew on weekends, evenings, etc. And I'm not wearing a hat, but if I was, hats off to the three of you guys. You all have been doing, an amazing job. Got a couple of questions, comments. First, again, back to what I was saying earlier in reference to the food insecurity issue. If it turns out that Senator Schumer is not correct, then the county, even though we don't have, our resources are quite limited between us and the local charities and the local houses of worship, etc. We will need to absolutely deal with the food insecurity issue. Wanted to move on. The couple questions. First, for the county attorney. Drew, the next meeting on the 31st, is that meeting going to be open to the public? I mean, will public be coming in to speak and testify? Will they be testifying remotely? How is that going to be handled?
If I might, I may be able to answer that.
Yeah.
Drew, you can let me
Go
know
ahead.
if I've said something that's what we're doing doesn't work. So the goal is to have the meeting virtually from the perspective of the public. We are working with AT&T. They have this service where you can purchase it, and it's almost like the way you manage calls at the EOC. They can see who's calling in, and they can direct traffic. So they'll be able to, if they're watching through our website or the number of television stations that carry our meeting, they can just call in, and we'll have that number scrolling the entire time. They want to speak on an item, they queue them up. They'll do it in advance, they'll do it during the meeting, so that anyone that wants to ask a question will be able to do so. while you transact the rest of the business.
Well, and the reason I was asking Drew was I was wondering for quasi-judicial hearings, are there going to be any, and how would we handle quasi-judicial through a virtual meeting?
I think, Senator, that we have them all on consent right now. If any of them are pulled from consent, we would give assuming the applicant were participating for right now, just while we sort through that, we probably ask them to accept their 14-day deferral or to the next meeting. I guess it would be not April 7th, but to the next one. If they don't do that, you raise a very good question, and I'd like to confer with Maite on it just quickly.
Okay. All right. Next, this to the county administrator, and it goes to a little bit to what Commissioner Fisher was asking earlier, perhaps from a slightly different viewpoint. I agree that what you've done with the realtors, obviously on pending closings, I think those need to be permitted. I don't think they fall within the essential operations. So I think that it does really need to be clarified as a separate additional letter. What are we up to? O, double P, something of that nature. But I think it does need to be clarified. Beyond that, and I've received a number of phone calls from lawyer friends of mine. I regard lawyers as one of our key professions, as I regard the realtors as one of our key professions. I've had a lot of lawyers contacting me asking, oh, well, that doesn't apply to me, does it? Or how I can get my firm. But we're really important. And I've told all of them that, well, I understand and I agree, but if everybody believes that their profession is more important and has to be an exemption, then we may as well not do an order at all. I know that this is coming up a lot, and so I would ask you, when you are considering what you're going to be doing with all professions, including realtors, lawyers, and anyone else, that you bear that in mind as you're making your decisions. I have two more brief questions. First, I have, again, since I've been at home, I've been watching news or reading news nonstop, and the president has indicated that he thinks no later than Easter, which I believe is about 2 weeks away,
April 12th.
April 12th, okay,
right.
That we should be, but prior to Easter, that we all should be going about our normal business and, stopping everything. And I presume that you have no intention of doing that, do you?
That's correct. I'm being guided by the cases that we are experiencing here in Broward and where we are. At this point, the way the EOs are written is until further notice. And I'm in constant contact with the counties to the north and the south, as well as the health department and the governor's office. So we're trying to keep the communication open. We're trying to make sure that the situation on the ground warrants any next moves that we make.
Okay, well, just speaking as one commissioner, there are two signs that to me would indicate that we can relax. Number one is when the number of reported cases starts to decrease instead of increase. And number two, and I think it has to be both, until the healthcare providers have all of their necessary ventilators, hospital beds, gowns, etc., so that they can treat the number of people. And when both of those are done, then I think it may be time to relax, but I don't think it's time to relax before then. And last question is, with all of the, again, and I'm glad you commented on the triple authentication, the dual authentication plus the other two methods. I don't know if that prevents spear phishing and other types of worms and things of that nature, viruses. So have you, I know that there's a lot of major corporations. I know Microsoft, I think I saw IBM, several of the major corporations that deal with IT have reached out to local governments and offered their services essentially for free. Have you reached out to any of them? Do you think this is necessary, et cetera? I'm just, what I have been reading is that there's a large increase in attacks on local governments during this crisis.
So I am a member of a subgroup of NACO counties. It's called the Business of Counties, and these are the counties that have a population of a million or more, and a population of a million or more. So we have been dealing with this issue long before this corona crisis. It's a big issue. Many of the counties are sharing their experience of ransom, and so we've been working very diligently to try to figure out what's the best way to do that. And we've had our systems assessed. We're doing a lot of things right. There's some additional things that we want to do without obviously having a big conversation about that. And it's not a money issue.
Let's not do that publicly.
No, it's not a money issue. So again, we're doing a lot of things right. There's some additional things that we can do, and the team knows that they are, just go get them. And they are consulting with a number of security related. I can't really tell you who they are, if they're AT&T or IBM or whomever they are, but they are very much on top of it.
Okay, and just in closing, again, thank you, and I know you don't sleep anymore, and I believe you've become an android or a clone or something, because I don't know how you're working the hours that you are, but thank you for that.
Thank you.
Commissioner Fisher?
Thank you, Mayor. I just want to go back to the realtors issue, and I think we've already clarified about being the essential part of it, but I just ask that maybe the administrator works with Mr. Sanders on see if we can come up with a palatable solution to the property showings. Would request that the Mr. Henry, reach out to Mr. Sanders on that. Okay.
I'm happy to reach out to Mr. Sanders, but I'm really going to try to coordinate a lot of. Again, we are, sometimes we're ahead, sometimes we're behind, but in terms of what the other two counties are experiencing with that and the pressure that we're getting to just get people off, home. They don't want people out and about doing things except that. So I'm happy to reach out to them and see if there's some middle ground. But I don't want to say that, for now that the answer is a yes, we can make it happen. I just would like to know more about what it is they would be proposing and how it would impact the overall goal of not having people socially contact with one another.
And he represents obviously Broward and Palm Beach and St. Lucie, so that would, you can see some synergy there on what they're doing as well.
Will do.
There's two other items I want to mention. This is more constructive than is constructive criticism and trying to find out solutions, and it deals with communication and timing. And obviously, Commissioner Furr mentioned about communication maybe through conference calls. We have so many available platforms we can communicate with today to get the right message out. And the PSA campaign that we voted on the last commission meeting, is that been implemented? We talked about the no touch and
it's in some of it has been. We've been showing some of it in a loop so that people can see it. Media buys in areas where we're targeting people that speak different languages. It's my understanding that those sort of went in today. So you'll see more of that. There are posters around. There's just a campaign. I'm happy to share that with you, but it took a while to kind of get all of that going because everything started hitting us fast and furious. And so I apologize for that, but they're up and running now.
And I don't know what the answer is, but as far as the commissioners needing the information briefed before the media and public, obtains that information, maybe it's accurate, maybe it's not accurate, but there were certain instances the last few weeks that I was finding out afterwards, and constituents were calling me and asking me, well, what about this, what about that, and I did not have any information at all. And finding out about press conferences, with little or no time to travel to attend them, and then finding out about, for instance, the Poplar Beach testing site by an email from someone else that had no location in it. And I finally had to ask around. And I know the staff said they didn't know anything about it. And again, the mayor shows up, which is a wonderful thing, and has a fixture opening the drive-through. And I do respect the mayor's position at all times, but I think all 9 of us need to have and receive the same information at the same time. And that's is the confusing part when it comes to the timing component, where the municipalities and the public look to us as Broward County to provide that guidance, that recommendation, to be the leader. In the case, I don't know that we were leading, and everybody was kind of being in limbo, especially when the issue came out Sunday night on the order coming out Sunday night. I think the mayor had a call on Friday evening with all the other mayors. We had the Miami-Dade, model to be able to follow. And so all of a sudden, get these emails from all the mayors wanting to do their own meetings, wanting to do their own orders. It just becomes a complete chaos. And then yesterday's order came out at 8 o'clock at night. And so my folks were, scrambling to get that information out, although we were told personally, hey, we were told earlier what the order was going to say, but staff said, hey, don't tell anybody until the order comes out. And then information starts coming out in other venues. And again, I start getting calls from constituents and from municipalities saying, hey, what about this order? I'm going, the order's not out yet. It just causes great confusion. So I just wanted staff to understand the frustration as a commissioner that the communication has to get a little bit better. We got to get the communication right to the media so they can get it out properly without coming along and just having all these other venues happening out there, with no accuracy or some accuracy, I don't know. So I just wanted to vent that to some extent and just hope that we can make those changes.
So from our, there was one situation that we would certainly take responsibility for. And I'm going to just talk about the initial emergency order. There was an attempt to try to do something collaboratively with our municipalities. A draft was sent, draft watermark all over it, nothing, just said, does this represent? Well, unbeknownst to me, that draft went beyond the mayors that had received it. And actually, I've been working with the chair of the League of Cities who understood that, that cities need, since they would be on the front line to try to enforce a lot of those issues, having some way to allow them to weigh in was important. He nor I expected that a document with a draft watermark would go all over the county and make its way all the way to places. At this point, I'm going to stop. But so after that, we've decided that we're just going to do things differently. We contact each of you when we have information. there are EOs that are coming out by, whether it's the governor or some other entity, that we have absolutely no knowledge of. And as soon as we get it, we pass it on. It is old information at that point, and we do apologize. But if I don't know about it or don't have advance notice, I really can't do much about that. On the information that we are actually promulgating, we try to reach out to each and every one of you before it comes out. Why? Because I know that you would be the first person in your district with your municipalities to start engaging in a dialogue. So we want to make sure you get it first. So I apologize. We are very mindful of that, and we'll see what else we can do to try to make sure that you get the information faster, if that is at all possible. And first, which is something if we're promulgating it, it can certainly happen.
I appreciate that. Thank you so much.
And Commissioner, let me chime in a bit here. The mayor's conference call was something we had one a Monday before, because many of the cities and municipalities wanted to ensure that we're engaging them and that they were participating as partners with us. I got a lot of that from many of them. So we had the first conference call on Monday, and they wanted to have a conference call every day or every other day. And I didn't think it was necessary for us to do so. The following conference call was on Friday afternoon, and to give update, to get input, because we're partners, and it affects all of us. And the more we work collaboratively, the better off we're going to be able to beat this virus early. On that conference call, I sought consent to at least get something done. Most of them expressed that they would like to see it done across the county. They didn't want to do it piecemeal, one in one county doing one thing, the other one, one city doing one thing, one in the other city doing something different. So they wanted either the county or the governor's office to lead that effort. And the governor's executive order 2070 actually gave us the opportunity for Bertha to go ahead and do that, in addition to what we had already done in terms of putting that emergency order in place. So we were working as together. That was the effort, and unfortunately, we felt somewhat betrayed that what we were working together on ended up going outside of where we thought it would have been from input from the rest of these mayors. So that is kind of how that happened on that issue. In terms of the testing site up in your district, the Broward Health folks, and actually not even Broward Health, but it was State Representative Patricia Williams who called me like the Thursday or Friday before and expressed interest in a site that was on Federal Highway that she thought I might know the owner, since I'm in the real estate business, and I thought that the owner I knew, but that property was known by that owner. I called that owner, and they offered some other sites, which was the Festival Flea Market. He's one of the people that I've known for a number of years. And I gave that information to her. She gave it to Broward Health. They called me back later and says, we weren't able to do that. They actually were negotiating with Bertha on one of our park site up until, I think, the day before this site opened. The morning of the opening, I got a call that they were going to have an opening. I think probably about 10, 11 o'clock in the morning. So it was quickly done, and things are moving fast, and Bertha says fast and furious. That's what's happening right now. And so unfortunately, notification didn't go out to a lot of folks on that issue for that side, and no slight intended of you or anyone else on my part, and I'm sure they were trying to get it done as quickly as they could also.
No, not at all, Mayor. I was not faulting at all. It was just trying to just trying to get the information properly, especially in your own district. You want to make sure that you're aware of what's going on, but absolutely no fault of any staff or just trying to make communication much better, more accurate, and not having, to be able to have that one Broward, one message. Thank you.
And unfortunately, staff wasn't aware of it until we actually I got the call that they were having that opening.
Thank you, Mayor.
Commissioner Udine.
Thank you, Mayor. Kimberly usually calls me. She has called me before all the press conferences if she can catch me in advance, but the phones have been nonstop. So I think Kimberly and all of our communication people, Margaret Stapleton and Kimberly Moreau and that whole team, they're doing a good job pushing a lot of information out 24 hours a day, day and night. And I get it. I mean, I have residents calling me all hours of the night, messaging me, middle of the night. Every business that you can think of pretty much has already reached out. I don't even know what to do on half of them anymore. So what I've been trying to do is just kind of forward them to Rocio in the county attorney's office and let her do it. And I'm hoping that at some point there's almost like attorney general opinions that I'm sure Rocio has a list somewhere. I don't even know because I can't keep up with all of them, but I think that is just, it's so important. And I'm glad that Sheriff Tony said what he said, because I've been telling people the same thing too. We all know that there's no way we can enforce any of this. None of these orders can really be enforced they're not going to take somebody to jail if they do a real estate closing. I mean, that's just the way that it works out.
And let me add, please, if I may, because I missed this in my previous statement. One of the main reasons why we wanted to get these mayors and municipalities involved is that we know that enforcement and reaching out to the business and at least warning and telling them would depend on their law enforcement offices. So we wanted to make sure that they were on board with us.
I'm glad you did that.
To make sure we were there, yes.
And then the one thing I will say is I'm hopeful, and I'm glad that the county administrator mentioned that. I think we need to make sure that we are reaching out to Palm Beach County and Miami-Dade County. I think we saw a good example of it yesterday with when you issued the emergency order on boat ramps, because we saw what was happening there. Miami-Dade did it, Palm Beach did it. I'm pretty sure that no one really cares if somebody goes out on a boat. It probably is not a bad thing for you and your wife, or kids want to go out on a boat. But what was obviously happening, we saw it all over the paper, is they were rafting up together, putting 25, 30 people on a boat up in Boca, down at Hullover by 17th Street. So we had to put that in place. I encourage the county administrator, to the extent that she has the time and the wherewithal to do it, to reach out to the other counties. I know this is not a big issue. I keep getting calls from golf courses who say that they want to be able to do it in a way that is socially distancing. They're trying to make the efforts to do something, but I get exactly what you're saying, and I agree with exactly what you're saying. If everything is essential, then nothing is essential. And I understand the real estate issue as well. You can pretty much do anything you want to do with a real estate transaction. It falls under the order that we have. You can talk to clients, you can virtually market. The only thing becomes whether you can show a house. And I don't know how we answer that. I mean, I guess speak to the other counties. What I do know is I saw signs not this past weekend, but the weekend before, of open house signs throughout cities. Okay, listen, I know real estate, I know the business. There should be no open houses no matter what they do. If you want to figure out a way to say if you can socially distance and bring a spouse to look at something, I get it. People are not to be sheltered in their houses as of yet. People are out on bikes. People are out, working out. But the problem is that when you start down this path, everything becomes an issue. Now, if you're going to have real estate showings, then you got to have home inspectors, because you can't do a real estate transaction without having a home inspector. So I just put that out there because it's a snowball that goes downhill. The other thing is, and I'm sure now is not the time to do it, but something that Commissioner Geller mentioned, I agree with. The technology piece of telecommunicating in the future is something that we have to take a look at with these vendors. And I have a feeling that they're going to be the ones pushing us as opposed to us pushing them, because I'm sure that that's going to be the new rage where we should be able to do, it should be no difference to the network if they're working in their office here or if they're working virtually. I get it if we're not totally there yet, but we should be in the future. And I think that we should work with our technology partners like Microsoft and we're not going to do it now because we got to put the fire out first, but as we move forward, we need to go from there. I too want to thank all of our county employees. They're working exceptionally hard. I say this and I mean this in a fully complimentary way. It's great to see our county employees stepping up to the plate. And, a few months ago when we heard they were leaving for the private sector because we couldn't keep them as county employees, I think on the other side of this situation, tragedy, whatever you want to call it, it's going to be very good that they were county employees, because it's going to be the other side on this case. It's the private sector that's going to take, a major shellacking here, along the lines of what Commissioner Sharif and Commissioner Geller mentioned too, with paychecks and whatnot. Those are my comments. Thank you to the county administration for your hard work, and try and get some rest. Drew, please take 2 days off and take a break. Sleep and get better so you don't have to keep going in for this. It's more important that you get well.
Thank you.
Thank you, Commissioner.
Commissioner Bogan.
Yeah, hi. I guess my first question would be going to our county attorney. I've gotten a lot of input on people asking if they could have a delay in paying their real estate taxes, and didn't know if there could be a grace period. So I wanted to see if our county attorney can answer that.
Drew, you want to take that?
Go ahead, Renee, if you'd like to.
Sure.
Did you say, do you want me to take it? I didn't hear what you said, sorry.
Whatever you'd like, so I'm happy to, sir.
Bottom line is, there's not much there, Commissioner Bogan. It appears, Renee, I don't know if we've gotten additional information on this, but our understanding of it is that our responsibility with the tax collector is largely ministerial, that there's supposed to be an executive order coming out any day now that would just extend the deadline from, I think it's April 1st to April 15th, without requiring the 3% penalty. I'm not an expert on this. Renee, is there any further development on that since then?
No new information, and you stated it correctly.
Didn't it already?
Okay, so it's out of our hands. It's out of our hands?
Right.
Yes.
It hasn't come out yet? I thought the governor had issued something to go until April 30th from March 31st.
It might have happened during this meeting.
Mayor, we will check. The last information we had, which was about maybe 90 minutes ago, was that it had not come out yet, and that the extension was just April 15th. If we get better information, Scott Andron, Mark Journey are on this call as well. Our whole team is. If they get other information, then they should please distribute, and we'll make sure that everyone has that information. Okay. The second thing I wanted to concur with Commissioner Fisher and Commissioner, I believe, Ryan. We have right now hundreds of people visiting Home Depot and Target and Walmart and Publix and Lowe's, and attorneys' offices are open, accountants' offices are open. And I hope there's a way, and I believe there's a way, that we can craft a house showing with one person going in a home, as long as they comply with CDC requirements. Someone coming in a home by themselves or keeping distance. Just like yesterday, I had a guy come to my home to fix my air conditioning. I kept distance from the guy, and then he left. I just don't understand how we can have permission for all these other places where they have hundreds of people coming to visit. And just think of what this is doing to our economy. People that may want to sell their home, if you're not going to allow them to sell their home, there may be more foreclosures. So just think of the flip side of what could be happening to our residents that may say, oh, I need to sell my home. I just lost my job. And if you're not going to let them, put up their house and to sell and to have a showing, as long as we give some guidelines of one person, keep distance. I know the board was not polled. I just want Bertha, that's how I feel. And I don't know how the other commissioners are, but that's my point on the realtors. And last, on the PSAs, I'm just going to recommend to Bertha that we put a lot more money into PSAs. I'm still hearing and actually seeing and hearing, these people who are touching door handles and they're buying things and putting their fingers on PIN codes for credit card machines. When they shop, they're still touching shopping carts with their hands. They're still touching gas pumps, and they should be using napkins, towels, tissue if they don't have gloves. And you just said, Bertha, you said that our goal is to educate. And I agree with you. But I think that we need massive education because there's only two ways to get the virus, and that's to touch your hands and get it on your hands and then put it on your face somewhere or to breathe it in. And so I'm really hoping that you'll put a lot more money into PSAs to our general population to stop touching things and to use, paper products whether you're touching a credit card machine or you're touching a shopping cart or a door handle or elevator button. So, so that's it for me.
Yes, sir.
Thank you.
Okay, let me share a little bit of information. There's.
Excuse me, I still haven't spoken
I'm sorry.
yet.
You're so right.
Yeah.
It's been pretty long. It's 4 o'clock almost
Yes,
now.
pretty long. You're right. You're right. It has.
Commissioner
But
Rich, go ahead, please.
Yeah, thank you. Thank you. I
5
just first
hours
wanna-
and 57 minutes.
Yeah. I just want to add my thanks to so many of our county administration employees who are, working so hard. And I do want to include, I just want to thank the administration. It's been very hard, I think, for you to have to call 9 people, or 8 because the mayor knows, but on many of these issues. But I do appreciate the fact that you are taking the time, to do that and to keep us up to speed. I have to say that I think education certainly is really important. I know that this is going to sound really probably not nice, but I'm going to say it anyway. I wonder why we don't educate the people in the White House. Because while we've been on this phone, the current administration has decided that they've, set a date for having the country, quote, opened up and raring to go by Easter, which is April 12th. Everything that I have read or seen says the only way to get this under control is to flatten the line, is to look at isolation, people staying home, away from other people. And I just think, we have to do what's best for our community. We can't control the whole country, but I wish we could, but I feel like this is the reason that Italy is where they are today is because people didn't take the isolation, staying at home, all of that seriously. And where people are doing it, there is, obviously, in China, we saw that. There is, in 2 months, they were able to begin to open up now. So we were talking before about, some of us before we came back on the call, about not having our own Passover Seders, which we have every year with family, friends, in order to comport with the goal of not exposing other people. And just because it's your family member, people need to know. Other family members have been exposed. They went to work. They've been in a different sphere, a different atmosphere. And we have to consider all of that, especially when you have seniors involved who are, more likely to, if they get it, have a more serious case. So I think, we need to protect our families, our friends, and the people in our community, which brings me to the last piece of this, which is everybody asking for exceptions and more people to be considered essential. And I think that we need to be extremely careful not to expose more people. And I think if we can find a palatable solution for something like the realtors that does not expose people, okay. But we can't keep opening this door up wider and wider and wider and expect to have the result that we need to have of isolation, people staying at home, not being with other people, and getting this line flattened out so that we can get back to some, normalcy in our community. Thank you.
Thank you very much, Commissioner Rich. If I may just share a couple bits of information here to the public. Broward.org coronavirus is where you can get additional information on what's happening with coronavirus in Broward County and assistance. For those who need to get unemployment benefits, reemployment insurance, the website is floridajobs.org, floridajobs.org. And for assistance with your small business, you can go to sba.gov, sba.gov. Also, there's an extension on filing your income tax to July 15th. That website, of course, is irs.gov/coronavirus. There's a small business emergency bridge loan program that's available. You can go to floridadisasterloan.org, floridadisasterloan.org. You may also take the survey as to what economic impact's happening on your business by going to Florida Disaster Biz. And the Broward County schools actually have a program now in place starting on the 30th where they will be supplying breakfast and lunch for children that are in need. That information can be found at browardschools.com. Actually news.browardschools.com. The food programs, for those who might need assistance with food, they can apply for SNAP food assistance program, food stamp program at myflorida.com, access Florida, myflorida.com, access Florida. Also, farm share. You could go to farmshare.org, agencies, farmshare.org. Additionally, feedinsouthflorida.org, feedinsouthflorida.org is another place where you can get some food assistance. The Broward County Medical Association, in partnership with City of Fort Lauderdale, Broward County Health Department, and myself, we're recruiting, credentialing, and managing health care volunteers for the Medical Response Unit. The purpose is to organize and rapidly provide verified volunteers, doctors, nurses, healthcare professionals, and support staff to assist the local Department of Health and other partners in providing for urgent medical care needs of our community. If you are able to volunteer, please contact Cynthia Peterson, CEO of Broward County Medical Association, and the phone number is 954-714-9477, 954-714-9477, or you may email cpeterson@bcma.com. That's cpeterson@bcma.com. Or Dr. Sturman at wmsmd@aol.com. Thanks to them for their help in ensuring that we're finding volunteers if the need arises for us to be able to support our community from a medical standpoint. I also would like to thank all of Broward County staff, particularly my staff, Heidi Richards, Lahoma Scarlett, and Lorraine Lynch for their support. We get a tremendous amount of calls, and I know that the rest of you do also, but you can imagine that we get more. Yesterday alone, I took over 150 calls and texts when I stopped counting to myself directly. That doesn't include the emails and the calls that came in to the office here. So I want to thank them for what they're doing. And again, our county staff has been really, really tremendous in their support. let me also thank you, County Administrator Bertha Henry, or Deputy County Administrator Monica Sapero, an assistant to the County Administrator Alan Cohen, and Ms. Kim Campbell. I know that Mr. Cohen actually delayed some vacation, and you had delayed your vacation for 2 weeks, County Administrator. She actually was to be on vacation right now, and she gave that up to be here to take care of us. And I've seen the hours. I've been here. I've called the countless hours. I don't know how you still stand up. I thought you'd be sleeping by now somewhere past that. But the energy that you've put in is really great. And I thank you on behalf of all the people of Broward County for the work that you're doing, and to all our staff. And by the way, folks, I just got wind that tomorrow is our county administrator's birthday. So we're going to sing happy birthday, okay? Happy birthday to you. Happy birthday to you. Happy birthday, dear Bertha.
Your Bertha.
Happy birthday.
Happy birthday to you.
All right, thank you. And thank you. With that, we adjourn our meeting.
Now is the time for everyone in Broward County to be vigilant in helping to stop the spread of the COVID-19 virus. If you are sick, please stay home. Avoid close contact with anyone showing respiratory symptoms. Avoid directly touching public surfaces like handrails or gasoline pumps. Wash your hands frequently with soap and water for at least 20 seconds and use hand sanitizers that contain more than 60% alcohol. Cough and sneeze into a tissue or your elbow. Avoid touching your eyes, nose, and mouth. Avoid large crowds. When out in public, keep at least 6 feet between you and others. Finally, keep calm and try to maintain a healthy lifestyle. For more information, visit floridahealth.gov.